Director Leach.
Present.
Director Jeffrey.
Present.
Director Stamets.
Present.
Director Morales.
Present.
Director Brown.
You with us, Terry?
Yeah.
Not hearing you.
Hello.
Terry.
There we got you.
This is Terry.
Thank you, Terry. Looks like it's recording.
Hold on, let me get it with me. For some reason it wasn't on the owl. Video went out, but it's not.
Can you hear us all right, Terry?
Sir, have you done this?
There it is. And she had delayed. Yeah, exactly.
Good to go. All right, we'll go ahead and start with the pledge. Here. Go. Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for one nation under God, indivisible, with liberty and justice.
And for the first time ever, 35 months,
Sounds like a car.
All right, let me mute that.
Terry's not driving, is he?
Okay, he's muted.
Yeah, Terry, we went ahead and have you muted because you had some background. So just unmute yourself whenever you have a comment. Just give us a hand thumbs up if you're good. Gotcha. Thank you.
At this time, we'll open it up to public comments. I have a couple cards. I'll start with those. If you didn't put in a card and you still want to talk, just raise your hand when I'm done with these first couple. The first one that I have here is Mr. Tim O'Leary. Sir, if you'd like to stand up.
Thank you.
You can go ahead and address the board.
Thank you.
Sir.
Tim O'Leary, resident, longtime resident. I just want to again thank you for the wellness center. I've attended 4 programs there, 3 of them now underway. Fascinating discussions, the post-COVID, the boundaries, the connections. But one of them I've gone to for various circumstances that I won't go into, but the bereavement group by Hospice in the Valleys. I didn't plan on talking today, but there was something at the last week's meeting that just compelled me to. There was this woman who was there for the first time, 30 years old. Her father recently passed. She's an only child. Herself and her mother have taken it really, really hard. He was like the light of their life. And I mean, she just unloaded. And it made me think there really isn't any place in the community where people can do that, except there. Various churches at times would have bereavement groups, grief counseling, whatever. But they come and they go, but this one is there, it seems to be for good. And it's just so needed. So I just want, you guys are the policymakers and the stewards of the facilities and the finances. So you might not get into the trenches quite as much as some people. So I just want to say thank you.
Thank you. Awesome. Thank you for those comments. We definitely appreciate here for people that utilize facilities for sure. Next up, I have Patty and Roger.
Good morning.
Good morning.
My name is Roger Shaver. I'm the president of the board of directors for the Foundation for Senior Care. And Patty here is our executive director, and Gail is one of our board members. Forever board member. Almost like I wanted to first of all thank the foundation or the health district for supporting us and all of the nonprofits that you do in Fallbrook. Without your support, we wouldn't be around. One thing that we are here to discuss this morning is specifically in your community contracts, grant policy, and procedures. On page 3, under prior grant recipients, we're having a major problem with this because if it is enacted as it's written, the impact on the nonprofits of Fallbrook is going to be devastating. And that's why we're here. Patty has some more specific information on how this will impact all of us. Thanks,
Sir, thank you.
Now Roger's gonna give me the hard part.
She's the numbers person.
But I do wanna, and I have this just for reference for you. I'm not gonna necessarily read from it, but it's the same document if you wanna pass it. Is that okay?
Yeah, and then we'll.
I have enough for.
Yeah, we'll put it into the minutes afterwards for sure.
Okay. So as Roger said, and thank you for letting me speak here, that the 4th year hiatus has been something, I mean, we were told 2.5 years ago, or whenever that first started, when that policy was enacted, that we needed to find other sources of sustainable income to help us going, not be so reliant on district grants, et cetera. And I can only assume, I don't know the conversations when that was enacted, that it is to enable new programming, because the same agencies will tend to rate higher in a lot of things, and then new ones that are trying to come in may not have that opportunity. But as we look at the impact of that, we realize what an impact it will have in our community. What I handed out to you is just the agencies and the programs that have been running for 3 years. This is our 3rd year grant process. And so next year, our summer water safety for Boys and Girls Club, Triple Play, the Food Pantries Hunger Program, the Senior Centers Congregate Meals, all 4 of the Foundation for Senior Care programs that are helping seniors in the community, cancer support through Michelle's Place, and youth mental health services and grandparents raising grandchildren. Without district funding, I don't know how the other organizations will do, and we are all working, I'm sure, to try to find other sources of sustainable income. But if it does not happen, the amounts that you see here for those programs and cumulative for the agencies, they're not trivial amounts to come up with through alternative sources. And those programs then for year 4, or very likely indefinitely, may not exist. For just looking at the foundation, $160,000 more or less is the average over the last 3 years across all of our programs. That's a significant amount to overcome and to find through other sustainable sources. So if it does not exist for 1 year, something will have to give. And one of our programs, either someone will not receive the caregiving and the respite in our adult daycare because it will not exist, or our care advocates who are helping so many seniors in this community will not have that resource, or will not have somebody helping them through fraud or abuse, or to find a house, because I won't have enough resources, if any, to keep it going. We won't have transportation for those that have no way to get to their doctor's appointment, or we won't be able to help someone through a transition from hospital to make sure they have what they need to be safe. And again, I can't speak for the other agencies, but I know that the impact is potentially significant. And if a program lapses in year 4 and we apply in year 5, we've just lost all the momentum and the public recognition and the staff that we would have perhaps not been able to retain in that 4th year. So, you know, I understand new programs, and even new programs, we've been encouraged, you know, come up, find new programs, new ways to help, or dig deep in a program. Even that, it draws resources away from our other existing programs that are stable and successful, or it takes money to bring in additional staff to bring those up, but we won't have the money for our core programs, so it just becomes difficult. And just for the Foundation for Senior Care specifically, and I'll wrap this up, I'm not going to go into the details that I wrote here. We have been working hard to achieve other sustainable sources of income. We've made, I documented some of the different initiatives and partnerships that we have engaged in over the last 2.5 years. And all of them have great potential, and they're just not there yet. Or they didn't turn out to be what we thought they would be. So we continue to work toward that. And the last thing is grant funding. This is not just Foundation for Senior Care, but I have talked to other nonprofits in Fallbrook. Grant funding for us almost has stopped. The reason I believe, I do not have firm evidence, but others that are in this community feel the same. In the last 18 months, almost every grantor that I have applied to, if you look at what their priorities are, their number one priority overriding everything else is diversity and equity of the population we serve. In Fallbrook, especially for seniors, even though we have a diverse population with a large Hispanic community, Hispanic seniors are 10% of our population, and we are 88% white for senior population. So when the Foundation for Senior Care reports what our clients are that we're serving, we are serving an equitable, we serve almost the same ratio as what's in our community, but grantors are looking at that because now this is their priority and they're saying no before they even look at our programs. So we're just asking you to be aware of the impact of that and be cognizant of how these programs may be impacted and how hard it may be to overcome a 4th year of no funding. Thank you.
Thanks, Patty. Yeah, I appreciate those comments. It's like I said, good to hear from the nonprofit groups. Obviously, this is something that we're going to address here when it comes onto the agenda here today. But I'm pretty sure that the board is going to be in support of longstanding programs that are having a lot of success. To me, it doesn't make a whole lot of sense to you know, like I say, stop the momentum of good things that are going, for sure. Do we have any other public comments or anybody on Zoom that would like to make any comments? No?
Allison has raised her hand.
Okay. Allison, if you'd like to make some comments, go right ahead.
Hi, good morning. Can you hear me okay?
Yes.
Good morning. Yeah, thank you.
Sorry, I was not able to be with you there in person, but thank you for an opportunity just to speak really quickly. I just really wanted to echo what Patty had to say, that taking a hiatus from funding after 4 years would be very difficult. Grant funding is always an option, and I am sure all of the nonprofits would agree we're always working 24/7 on increasing our grant funding. But Fallbrook is a small community. Other communities I've worked, larger cities, there's a lot of opportunity for grant funding, and it is just a lot more limited in our Fallbrook community. And the regional health district has been such an integral piece in funding these very vital programs to the community. And so taking that 4th year off, you know, as Patty mentioned, it really would result in the reduction of some of these critical programs for our community. And I'm not going to belabor the point, just wanted to echo what she said. And it sounds like it's going to be a good discussion. So appreciate all that you all do for the community and your hard work in working on your strategic plan to really, you know, increase your impact on the community. It's very appreciated. So thank you all.
Thank you, Allison. Okay, so no other public comments. We'll go ahead and we'll move on to discussion items. The first thing that we have has to do with the community health contract, grants, process, and policy. I'll let Rachel kind of take the lead on that one.
Sure. You know, each year we redo our grant policy to keep it updated. That's what Raquel's got for you on the screen. I didn't print out copies of this. You see it every year. Hopefully your recollection of it. Really the part that I wanted to discuss is as we start moving for not this next fiscal year that we just are about to enter, but for 24-25, we know that the expenditures for programming at the wellness center are going to be fairly significant. So I think it's time to have a solid conversation about an agreement or understanding, provide some direction toward the overall revenue proportion. So you should have, I think, in the packet of stuff you got, yeah, there you go, a multi-column, 4-column page that will talk about the fiscal year, the percent of our property tax that was provided to district grant funds. Historically, that's hovered between 35 to 39%. At one point, we did have some higher, during COVID, it made sense for us to provide some higher support. I think it's worth a conversation around being comfortable knowing where we're going to go with this, so that as the team and I start doing some long-term planning on programming out there, we can have a better idea of what that funding will look like. Last thing I think anyone wants to do is bring programming in, Patty's point, bring programming in, get it started, and then due to funding, you decide to cut it. That goes for districts as well. So it'll be important for, I think, us in a long-term standpoint to understand proportionally, if we're going to say, we're going to cap 40% of the estimated property tax to go to grants, and then the rest can go to district operations programs and such, or 35, or whatever that percentage kinds of looks like. I think that will go a long way towards some of the long-term planning. So that's one of the first parts I put out just for discussion, and then you have that historic piece there as well, in case there's any questions on that.
Well, thank you for that. I think that's definitely something that we've kind of talked about looking at here. Do we have any comments from facilities first? I don't know if Terry, if you have anything, or Jennifer, if you'd like to speak to your thoughts on that.
Okay, on the proportionality?
Yeah.
Okay, just from a facility perspective, or?
From finance.
Because you're on both.
Finance,
Yeah,
okay.
I'm not sure if you guys
Okay.
have any thoughts on that.
I'll defer to the chair.
Oh, there he is. How you doing, Terry?
I'm muted.
I think you're muted.
No, he's unmuted, but we're not hearing you, Terry.
Okay, how's that?
Better.
You hear me okay?
Yep.
Yeah.
Nice and clear now.
Now you hear me okay?
Yes.
Yes, okay. So for me, I think that our policy of limiting a grant to that having been said, it would certainly make sense that with some of our, or a 4th year or a 5th year, that they can certainly do so, but they need to come before us and make a case as to why they should have extended funding. And that gives us the option to either grant it or not, or to give them something different than what they've asked for based upon their case. So we certainly have the resources to do it, at least at this point in time. That's kind of my sense of it.
Understood. In regards to, I guess what I'm getting at here is the proportion. So I don't know if you have any thoughts.
Good. Thank you so much. So much of this conversation, of course, is intertwined with what the board as a whole feels is the future of the physical plant at the Health and Wellness Center.
Yeah.
Because that has to be taken into context. So with that said, I do believe there's some wisdom in agreeing on a range of proportionality that can slide as conditions change, but that we look at our historical, for instance, for grants, we look at our historical way of viewing our property tax income, and it looks like we've hovered in the high 30s. And there might be benefit in deciding that as a starting point, we do a proportionality perhaps at 40%. And then we have 60% of our property tax income, setting our nest eggs aside, that we can then work with in terms of depth of programming at the Health and Wellness Center and the ability of the organization to function. So I favor some sort of parentheses that allows our community to know, hey, the health district is shooting for 40% coming back to us, which I think is a fair amount.
Yeah.
All the while building the amazing programs that are already at play, which got a lot of feedback, positive feedback at the Discover Fallbrook last night. So I favor a proportionality framework to guide finance, facilities, programming, etc. So that would be my thought.
Yeah, I'm in the same boat. I kind of look at this as three buckets as I've come in here. We have capital improvement, which is kind of a mouse going through the snake right now. We got to manage that through. But on an ongoing run rate, we have a set of programs that should be capped at some level for the grant process, whether it's 38, 40, or 42, unclear. And I think it's going to migrate based on the yearly needs that pop up in terms of physical improvements and new programs that may come up, new entities that may pop in. But I think we do have to kind of frame facilities, grant, and programs in-house as some sort of a pie that we're managing on a rough basis, and then divvy the funds based on that with a lot of visibility. Then there's no uncertainty in terms of what we're doing and why we're doing it.
Yeah.
So that's my opinion.
Barbara?
I would agree with my associates here in the fact that the guidelines need to be revisited with regard to these long-standing relationships that we've had with our grant recipients and what their contribution has been to the overall wellness of the community by their efforts. I really believe that our future is going to be strongly changed to local government instead of it coming from the top up there in Sacramento or wherever. Healthy communities and the local government is going to be more important to having a very, shall we say, vibrant community. We're in an awkward place right now because we went through this pandemic thing. We're going through economic shakeup. We need to get accurate current data. But these groups that we have worked with who have had their programs, irregardless of what has happened, have kept on going. And it just shows the dedication to the goal of their program. This is to help improve the wellness of that entity, that family, community, etc. So I think we need to appreciate that and take a look at revising the dollar amount with our tax revenue to what degree our grant recipients have been working with the community and the measurable outcomes. I'm not going to worry about the diversity and all this other stuff. I think this is just a narrative that they're putting up there, and it's just a roadblock because we're all brothers and sisters. When you get down to it, we all have the same needs. And so if we work on the basis of, we are all one in this community. Our services are not separate from anything else. Everybody who is in our residential area can access these services. So I would like to keep that ball rolling. And it's all about having a vision of wellness programs available to help families, help individuals make decisions so they can be their own care advocates and they can get the assistance that they need physically, mentally, and spiritually to continue moving forward in a healthy community.
Awesome. Yeah, that's I appreciate those thoughts for sure. I think that obviously today we're all kind of discussion items. We're not taking any action on any of these things. I would kind of propose, I like the range that we kind of discussed there, maybe high 30s, low 40s somewhere. I definitely agree that, if we're looking for a long-term ability to plan our finances, I mean, it's extremely difficult if we're saying that it's going to go from 59% to 60% 1 year. I mean, I think that, there definitely should be some parameters there so that we can plan, and especially with a lot of the programming that we're trying to pop up. So maybe we can send that back to finance, and you guys can kind of maybe come up with a recommendation as far as a percentage there. And then from there, we can get it back to the board and approve a policy in regards to that. That's okay with everyone. Yep. Okay. The next item here we have has to do with service areas.
Right, and I wanted to just bring that forward. Obviously, that was a conversation that came up at the last grant review process. There were some questions, concerns about how programs are supporting certain areas or not, or targeted to specific school sites or not. I wanted to just remind you that in our policy, it is very specifically spelled out that they must support at least their participants of the program must be at least 80% of participants are district residents. That is really the only geographic constraint. So just wanted to follow up on that conversation. We know that some of the entities may have access to only a singular school site. They may not have access to all of them. That's outside of our control, or even sometimes that entity, because they have to now work with school districts, and school districts don't always have the availability in all their sites to make those things available. So I just wanted to bring that back forward to make sure that we all have a similar understanding or clarity or comment on that particular piece.
Sure. You know, from my perspective, I mean, I mentioned it, I think when it came up before, that I think that that's kind of limiting our ability to kind of get things done. Some grants, I mean, it might be, you know, they could only do it in one site or one area. You know, I think that in regards to something like this, is putting some sort of limitations and saying you have to do it in every segment of the town is just going to make it tougher for the nonprofits. I mean, I think that the nonprofits are trying to provide services, and if they had the ability to do it everywhere, I'm sure that they would, you know, I mean, my opinion is just to kind of leave it how it is. And, you know, as long as they're serving the residents of Fallbrook, I mean, I think that that's a good place to start from. I mean, I think that maybe in some of the discussions, it's cool to maybe encourage them to, you know, expand or say, hey, like, you know, I certainly think that we should try to support more programs in Bonsall for sure. But I just would hate to put some handcuffs on us. I mean, we're discussing here, we're going to be discussing potentially having to change policies on the 3-year thing, just because of the same sort of thing. I mean, like I would like to encourage more programs to apply, just like I would like to encourage more geographic areas to have some of those programs. But you know, I kind of think it's kind of out of our purview to do that. But
I think Terry's got his hand up.
Oh, Terry?
Go ahead, Terry.
Can't hear you, but
Okay, so for me, I hear what you're saying, Bill, and I understand that not every agency can reach out to all 4 corners of our district. But to my mind, where an agency cannot provide service of some sort to Bonsall, Duluth, or Rainbow, then if we're that passionate about a particular service that we need to provide, that we feel that we need to provide, then it's up to us to find out some way to put that out there. Just to let an agency off the hook and say, well, if you can only do Fallbrook, then don't worry about Bonsall and Duluth and Rainbow. To my mind, that's not right. We ought to be able to reach ourselves out if agencies are not able to do that. If there's a service that we're that passionate about. So that's my sense of it. I would just like us not to adopt a policy at some point down the road that's going to let us as board members off the hook as it relates to assuring that all of our constituents have an opportunity to enjoy the services that we're going to support. And that's where I am.
Terry, may I ask you to clarify, are you talking about satellite offices? Are you talking about additional sites that would provide the same types of programs that we have here in Fallbrook?
Okay, what I'm suggesting is if an agency is too small to provide additional service outside of the Fallbrook city limits, so to speak, then the district ought to be able to arrange to provide that service within the Health and Wellness Center. Granted, that's not out in Bonsall, but to find some way to get the people in Bonsall, Duluth, or Rainbow to come into the Health and Wellness Center, or to find some way to have that service provided. So I'm not necessarily, I wouldn't rule out satellite services. That may be part of our responsibility, quite frankly, down the road. So that's kind of where I am. But let's take it on a case-by-case basis. But let's just not rule out that and leave it to an agency to provide the service to the best of their abilities. Well, that's fine, but it may not be doing our constituents the service that we're obligated to provide.
Understood. Can I start on this side, Jennifer?
Thank you, thank you. So I just want to describe what I think you're getting at, Terry. So for instance, in funding the food bank here in Fallbrook, would your idea be that the district would then have a food bank weekly distribution in Bonsall? Is that an example of the idea?
Terry, you need to unmute yourself again.
Terry, need to unmute. Terry.
Maybe just maybe hold off on that question. I don't know if you have anything else we can.
There he is.
Okay.
Were you able to hear me, Terry?
Yeah, I hear you fine. So what I was suggesting was we wouldn't necessarily have to set up a satellite food pantry, but we could certainly set up a mobile food pantry that would go out to certain locations outside of Fallbrook to make food available so that our constituents could visit that food pantry truck on a Saturday afternoon, or that sort of thing.
Thank you.
Anything else, Mike?
2 questions. So you mentioned the 80%, Rachel. That's 80% outside of the Fallbrook, Rainbow, Duluth, Bonsall.
They must support 80% within.
Okay, what drove the 80% versus 100%? That's some historical stuff, I'm sure, and I probably don't have all the history, but it's a flag for me in terms of why isn't it 100%? There's probably a great reason some point down the road.
Part of the history on it, because this is a long-standing thing.
Right.
Part of the history had to do with the fact that we may have a client who lives here, their family lives in Oceanside. Okay. So we're supporting that family in Oceanside as well because one family member is here.
Okay.
For example, if Patty, if you don't mind, I'll use the foundation because
I was going to use the same example.
Okay. So it may be that, let's say we have a senior here.
Right.
The adult children live in Oceanside, Temecula, Wisconsin. Even though we're serving that senior,
gotcha,
those family members are indirectly benefiting.
Okay. All right.
The other part to consider is the fact that many of the folks that we may serve through the Myriad programs may be transient military. So their residency is not technically Fallbrook, Rainbow, Bonsall, Duluth, but they're here.
Gotcha.
And so the idea is we wanted to make sure that the strong majority of programming dollars stayed with local residents.
Okay.
So the 80-20 rule, several years ago under a previous CEO, there was a short-term report where people had to report the zip code of the clients, a very unwieldy process, but every single entity had maybe 5% or less that were outside district residents. So it really is a very teeny tiny percentage.
So it's not driving large buckets of shifting dollars as
No.
a result of that. It's just more of a policy statement, but it's not really
Right,
impacting ability to add more funding globally.
right. We're not seeing district funding going outside the region.
Gotcha.
Barbara, anything else?
I would just like to comment that, being in Fallbrook for 23 years while the hospital was open and operational, these areas that we serve as part of the special district, they had to come to Fallbrook Hospital to get services. It was a blessing. We did have the landlord title, but we did not have the operational title for the hospital. So when that went away, and the entity that had pre-leased the hospital for that period of time, was a 30-year prepaid lease, decided to go about their business and it wasn't serving the community, we ended up becoming without a hospital. Now, we had constraints put on us by the government because we had other hospitals that were being built in Temecula, which is like 12 miles away, but it was affecting us because we were unincorporated. So getting healthcare services and other services as well has always been a challenge in this community. And we are working to develop this. This is a brand new concept, this wellness center. And we're a growth that is going to continue to evolve. And so to consider all of these other options to serve these other areas is very well received. It just needs planning, because now we've got this piece of real estate that we're trying to develop so that these other entities that we're partnering with, we have the grant recipients, are able to utilize our properties for events, etc., and meetings, bringing down their cost of wherever they are, and also working as like a connective consciousness, all to contribute to the wellness of the community. So it's just an enormous change that we're going to be facing, because people are used to going to their local area and getting what they want. The healthcare district is the healthcare communities, the healthcare insurance, the healthcare world is changing dramatically. So the idea is to know that we can work together to solve this. We can do this. There's food out there, there's resources, and we're all willing to apply whatever we have available. It's just making the availability component available to those areas where in the past, they didn't want anything to do with going into that community and creating a service. And I experienced this when the healthcare district was trying to create a dialysis center. We wanted to partner with a dialysis center, and we were not welcome in any of the areas because it wasn't conducive to their business plan. They didn't want healthcare resources in their little mall or whatever. And so the company they were talking with finally said, well, we're just going to develop it along the 76 because that's where the traffic's at. And so we had to accept that, but we were then without a dialysis center. So it's been challenging all along, but we're going to overcome it. So it's just the idea that we have to go through the process, understand that we're in development constantly, and we're going to work on all of these because we have great partnerships. And as long as we're on the same line, which I believe we are, I think we're going to get there. So it's just overcoming the hurdles.
Okay, my thoughts real quick is we're kind of discussing the grant policy and how to kind of force some of these grant holders to I guess go to all areas of the district. I think that also we're kind of talking about some services, like we're saying, like, hey, the district is maybe we'll do A, B, or C to try to do that. I think that's kind of muddling the discussion a little bit. I mean, I would be in favor of us as a district trying to provide more services to places like Bonsall and trying to, to lose Rainbow. I think that it's their tax dollars that they're paying, you know what I'm saying? And the same thing for, the Horse Creek community. That's a growing area. I think that as a district that we should be trying to, market to those people, talk to those people, hopefully in the future, like provide, services. I think one one thing that we could do is maybe partner with the Bonsall School District so that we could have a facility out there that we could do some sort of services at, or maybe a blood drive or something. I'd be in favor of anything like that. Maybe we can send that back to the committee level and see if we can figure that out a little bit. I wouldn't necessarily be in favor of trying to force the grant recipients to do a certain thing or write the grant a certain way. I, personally don't think that, we don't have the authority to, we're asking them to write a grant and we'll look at it and approve it or not. And obviously there has to be some parameters there, but I don't want to be in the business of writing the grant for them and telling them exactly how they have to do it, or, getting ourselves into a position where because of like good meaning thoughts, now we're having to fund a grant in Duluth, like, drive out there or something, so I mean, maybe we can send that back to some of the committees and
Our legal counsel.
and and again, I would maybe we can direct staff to see if we can find more partnerships in some of those communities, and I mean, as we're looking at services, like maybe we could keep that, you said like a blood drive out there, some of that type of stuff.
Some of those services that the district is doing, we've already started creating certain partnerships. We can work to expand some of those.
Yeah.
Our existing grantees, perhaps we can take this back to strategic planning where some of this policy will happen.
Okay.
We could potentially talk about addressing a question where they have to at least indicate where they're serving in a little bit more depth. There could be some scale to some amount of funding or some part for the grantee to understand that we're interested in them being able to support more areas. So that can be a follow-up conversation, the development of a question on how they could do that.
As I remember, when we were addressing the grant processes years ago, and this is when the chief of North County Fire was a member of our board as well, and he was just making the call that the grant program needs to reiterate to the applicants that this is basically seed money to help you get up and where you're going. And that's how it started out. And so the criteria was that certain things had to be met because the intention was that you could get to a certain level and your program would be able to be, we could augment their program, but it had to be sustainable. They had to be able to sustain a program.
Unfortunately, we're talking about the different areas where we're serving at this point.
Right,
Yeah.
right. But that's how that got in there to begin with. I'm in favor of revisiting this thing because the dynamics have changed. Our community has changed. We may need to take a look at how we want to address this and find out what we can work out to make it more comfortable so that the relationships can continue to thrive and grow together. Because we're not here to put the constraints on it. That's not what we had the grant program for. But when it's inception, there were certain things that were put into play, and that was kind of like the baseline. So they've grown. There's no denying the need for the funding. There's no denying the fact that they're doing a fabulous job. You just have to take a look at the big picture from where we were, how we got to here, and what we can do to now revise it.
Understood. So if we could just kind of, we'll send that back to strategic planning. I'd like to, see if we can get more, district resources kind of heading that way, and then I guess we'll revisit that in the future unless we have any other thoughts.
Just one more before we move off of the community parents. I asked Rachel to provide us with the most recent census data. And I think this is an important thing for us to keep in mind. And I'll give mine to our nice visitors here because I go to community meetings where folks will say things like, we don't need help with transportation. We're a retiree community. We don't need to worry about that. But I think we see that we aren't a retiree community. We are 20 and 23% 65 and over. Our largest demographic that pay taxes are 56% and 57% 18 to 65. So I just want us to keep in mind the census compass points about the proportionality of the population we serve, and also that, K-12 is 69%. So we've got some interesting data there, just to put in the mix, if you don't mind. So that's, I want to thank Rachel for providing that.
With regard to this, may I ask what date, what date this census
The
data?
most recent.
Yeah, this is 2020 data.
2020, okay. I would challenge this in a heartbeat because our community numbers are much greater than this. Absolutely.
Well, the census is done every 10 years.
I know, but what I'm saying is approximation and in real time, we've got a bigger burden than what's reflected here is what I'm trying to say. These numbers are like, okay, these are the optics, but in reality, we are dealing with a much bigger population.
Tell me a little bit about that.
Well, I've seen the numbers of Fallbrook, the population of Fallbrook at 40,000. And
well, here's 46,000.
Okay, that's talking about Fallbrook, Duluth, and Rainbow. Yet we have had a growth in our community because your schools are filled with children. Our senior population is growing as well. And we have people moving in, and we really don't know the exact number of what our community residents are right now because there's been so much flux. I'm just saying we just need to be prepared to understand that this is going to be a bigger impact on us because these numbers need to be brought up to speed.
Yeah. So 4 years ago, this was a snapshot, and we're now here. And of course, we would want to monitor.
Absolutely.
So, but this is a starting place. Right, proportionality.
Absolutely, but I'm just saying we're going to have to put. We're going to have to be prepared for this to be much larger than what is reflected here, because I wish the data would be current as much as possible. And the idea of a census every 10 years is ridiculous.
Okay. Well, I offer it as a point in time snapshot of our community, and I'm sure we can look for other updates, the real estate market, and all of that.
Absolutely,
Yeah,
absolutely.
So thank you.
Really stupid question, because I'm allowed to do that, right?
Yes, you are.
Would these numbers not generally supposed to add up to 100% somewhere, or is this somehow slicing in different ways? I'm a little confused about how that's broken up.
Okay. So the three.
These are the 8 buckets?
Uh-huh,
Oh,
8
gotcha.
buckets,
Okay.
yeah.
So you're splitting.
8 buckets and then other.
Understood.
Yeah.
I know the data.
Okay.
So thank you for that.
Good adding.
Info, go ahead and move on to the actual policy, future priorities. I think that this is probably the heart of some of the comments that we got earlier. Personally, I mean, I'm not a big fan of the 3-year rule per se. I mean, I would that would be one thing I would say, just scrap it. I mean, I think that the idea was to try to get better grants. I think that having seen some of the grants, like the board talked about just getting the same thing every year, but the flip side of that is some of those programs are just successful and we want to continue to support them. I mean, stuff like the food pantry. I mean, people aren't going to get any less hungry next year. So I mean, if it's a successful program, I mean, doesn't make a whole lot of sense for us to cut it just so that, or to tell them to write it in a different sort of way. Or I mean, that's just silly. It's a waste of everybody's time to me. So that would be kind of my thought on that. I don't know if there's any other areas on the policy that you guys have read that you have to take issue with, or you'd like to make any comments about. But
no, when I reflect on this and I hear the challenges that are being faced, I think that's what needs to come out of the process. What are the challenges and how do we address them?
Yeah.
And I think there's also a tiering of some sort that could be developed where you've got core capabilities and programs that are absolutely critical to the community, that are growing, sustaining, and doing all the right things.
Yeah.
There are up and coming, which we need to fund and seed and then test for growth. And then there's the ones that are kind of in the middle that are moving along, but maybe don't have the right programs in place to try to get that additional funding, or don't have a good story as to what they're doing to get that additional funding. And I think in grading those, we can somehow develop a core up and coming and watch list, if you will, of grant recipients that we should support with some criteria around how important it is to the community and what holes they're filling.
Yeah.
So that's how I kind of look at this. I understand the metric and why it's there. I think it makes sense. I think there is an accountability for how you do your funding, how you get additional funding, but at the same time, we don't want to just have people disappear because of this arbitrary rule. So that's where my head is right now.
Yeah, I think I like that idea as far as breaking up the grants. I mean, I think that as a board, it's great when you look at the grants and you see a new program, right? And it's a, hey, that might work, or we'd like to support that, or but I think that's a good way of kind of breaking it down. Jennifer, do you have something?
Yeah, I'm totally in on considering. I know we're not gonna make decisions today, but I'm in on all of the things that have been said. I think that there is room for some categories. We could do new programs. I also agree that for core services like food and other kinds of core programs, that we should probably rethink the 4th year hiatus, because I certainly hear the problem here. And I'll tell you, the arts group has run into the same thing. There are absolutely no grants that are available. It's dried up totally. Yeah. So we're kind of we're the king and queen of grants around here. We're basically the ones that are available. So yeah, I would agree to all of that.
Barbara, anything?
Just be aware that this is like going into the political end of this is like election year. You've got all this dynamic that is affecting people's perception of what's going to happen in the future, and even into the mortgage and finance industry. They're tapping the brakes really hard and doing double due diligence on whether they want to lend you the money or not. And all of this does have an impact on us for sure. But I am all in favor of revisiting these core groups that have contributed so greatly to our community, making resources available for shared efforts that support their work, like the food pantry, like the Foundation for Senior Care, and the Wellness Center. The idea was to get this piece of real estate and convert it into a place where we could all work together to each other out to keep the community healthy, and it was a resource for making them their own case managers, their own patient advocates, and making decisions about their own families.
Terry, do you have anything?
On the road.
Any comments?
There, how's that? Okay. I certainly agree that we need to have some flexibility with regard to those agencies who need some additional help on the 4th year. Jennifer makes a very good point in that regard. For us to have some more outreach, we brought people on board who can help get our message out, and we may want to consider making some formal way for that person to reach out and maybe talk to Bonsall School District as an example. Do you have a space that we can use on a regular basis to provide services of some sort, or support services in the Bonsall area or the Duluth or Rainbow area? For example, they have the food pantry truck go to a certain location out in the community 1 day a week to provide some other specific service that one of our agencies can support at a location that we arrange. That to me makes good sense, something that we should be doing. And I really agree that we are the kings and queens of grants in Fallbrook. And we certainly have enough money to pass around. So let's make the most effective use of it.
Awesome. And I just want to say, you know, I agree with Barbara too, as far as it's crazy to hear that you guys aren't getting some of the grants because of the diversity stuff. I mean, it doesn't matter. People shouldn't be denied grants because of their race or their, you know, factors that are out of their control. I mean, if there's a need.
They've never denied services to anybody.
Yeah.
There's never been any kind of issue of that in any wisp of form.
Yeah, I mean, treat everybody the same, right? So, I mean, we have this on here, MOU for ongoing services. I don't know if the idea is to maybe try to merge some of those core programs into MOUs, or if there's an ability for us to potentially do any of those.
Really the point that's on here is we already have this interest in some of the programs that are more interlaced with district operations to move from a grant process into the MOU. I wanted to put that on here. Obviously, I'm going to start fleshing that out and bring that policy back. As I start to bring and flesh that out, I wanted to see if there was any particular guidance or preference or priority from the board on what would qualify for an MOU style program as opposed to a grant program, right? Just because it's a long-standing program doesn't make it the perfect fit MOU for us. When we start talking about MOUs, we talk about those programs that will be able to function out of the wellness center primarily. That has been the main crux of what I've heard. So I want to make sure the priority as I start drafting that out before, because not everybody can MOU, or else we might as well just close everything down and say, here's your grant money and not offer anything. We have to have clear direction as to what fits to be an MOU. And should that be a 1 year, 2 year? Obviously we can build in flexibility for that, but I'd like to know the idea. Again, strategic planning should be a 3 to 5 year vision, not a year to year, because we just can't make solid investment in things if we're going to change it every single year. The MOU is part of that longer term vision.
Yeah, I vision that actual agenda item is almost secondary to the work that we have to do on the strategic planning. It's a way to either tier a grant program or it's one of the programs. And I've been kind of, as I'm listening to all this, taking some notes in terms of how to simplify this framework that we're trying to move to in this 3 to 5 year window. And when we're ready to talk about that, I'd be glad to spew that.
Yeah, well, right now it's good.
Well, as I've been taking notes here, I think about the themes that are coming out as we're having these discussions, and I keep them pretty high level, keep them simple, but the first one's bucket the budget. So how do we bucket the budget into these categories of miscellaneous, facilities, grants, and programs? So I think those are the overarching elements of the budget, of how we partition that dollars and what are the guardrails around those 4 buckets of the budget. Secondly, complete the wellness capital improvements. That's a key objective for the next period of time. Whatever that ends up being in terms of how we're going to allocate those dollars, what programs we're going to do. Third, strategic grant funding, the longevity element of what we're going to do there in terms of that, the tiering of those grants. How are we going to grade these grants? And then ultimately, the MOU, I think, comes under that bucket. It's part of one of the tiers of the grant migrating to an MOU, a relationship based on core capability, how well they're run, and filling a gap. Third, the programs internally, how we're going to fund those. What are the buckets? How do we drive from maybe a grant situation to an internal program? What are the kickover points that say that's a program we now want to fund internally? And then lastly, community outreach across the district. So how do we identify with all the partners, quarterly, whatever the right metric is, of holes that exist and how we can expand those holes. So those 5 themes are kind of what I'm hearing that we had to focus on from the 3 to 5 year perspective. And that's kind of where my head is right now. So that's where I see us kind of moving to get us to that conversation. Then you fill in the objectives and metrics and the smarts underneath all those things, but that's where my head is right now. So
I support that 100%.
I think it has a clarity to it. And I would add, would you say there was another area that we do that is like the keeping the district running?
Miscellaneous bucket of just there's facilities, miscellaneous facilities, grants, and programs are the 4 buckets I kind of had from a budgeting perspective.
I think organizational aspect is a little more than miscellaneous.
Okay.
It's this whole team here.
Yeah, miscellaneous, I first thought was the unforeseen, kind of a slush fund. I hate
Yeah.
to use that word,
Yeah,
but it
yeah.
is kind of catching. So you're right. That's a good one too to add is
If we're looking at the whole of the.
administrative. Yeah.
Yeah.
Yep.
And those fall kind of neatly into our committees,
Yeah.
kind of, sort of.
Yeah. Well, I
Thank
think
you
that's,
for,
no,
thank
that's
you
what,
for creating this.
Yeah, well, I think a big part of it too is once we establish, that, hey, the next 5 years, we're planning on doing 38% of the tax funds are gonna be grants,
That
that gives
becomes a
us the
budget item.
opportunity to say like, okay, well,
Right.
what sort of programs and what sort of, you know,
Make your trade-offs.
projections do we have
Yep.
for staff and everything else.
Always
But,
maintaining our ability to slide as conditions change.
Yeah,
correct.
Yeah.
Yeah, and that's kind of where and once you have a framework like that, then you can move those buckets around based on the individual yearly needs that occur. Yeah.
I guess coming from a lot of this grant discussion, if we could kind of just send some of that back to strategic planning, and maybe we can kind of try to look at some of the potential programs to establish MOUs with, you know, we can kind of look at some of these discussions that we had and kind of bring that to the board.
I'll take Mike's bucket list over there.
I'll write it up.
Appreciate that. And we'll bring that back and use that a little bit as a framework. You'll have, as we go a little bit farther down, you have this template that's based on this year's strategic planning. Some of those buckets align with what you pointed out. I think this might be the year to say, let's pull that into strategic plans and then move that forward. I know that Patty had a question if.
Oh, yeah, if we could just, I'll open it up to public comment if you guys have anything. Patty?
I have two questions and you may not even, Rachel probably has the answer at least.
I hope so.
I've been looking at budgets and grant allocations over the years. And so my first question is, what is direct services and how do direct services differentiate from grants? And then is there a tie-in between direct services and MOUs that you were just, are MOUs your direct services? Can
Right, so in the
clarify that?
In the budget that, I do actually have an answer for this. Thank you. Okay, we have that budget line item that says district direct care services. That has enfolded things from historical and now that are things that the district funds or sponsors directly and or operates directly. So district direct care services included historically more of the North County fire programming. So we provided grant funds for them on this ongoing. So that became more of a district sponsored thing. It fell outside of the traditional annual grant process. Other district direct care services were
Thought I saw something about counseling or something like that.
that's a potential future option.
Oh.
So currently, this is gonna be something like, when we're doing blood drives or we're doing the old, the prostate screening exams, those were district sponsored, funded, expensed. So that fell into that line item. In the future, the idea is that those MOU programs would fall under that expenditure. So you'd have your grant funds, things that we own, we sponsor, we do, and then those potential MOUs would all live in that general category.
Okay. I thought there was the tie-in there, but I didn't understand it, direct services, so thank you.
So I'll direct you to the posters on the wall, where I made lovely pie charts. Some of those grants that were district direct care services were those North County things in particular. So that's why when you start looking at the grant distributions, if you look historically, some of the hospital auxiliary things used to fall into that. So we're trying to keep that continuity going forward so that we can be accountable to the public to say, well, where did those support dollars go? Because if we just say, oh, just the grant dollars, we're missing the other part that the district has done to support the community. So I want to make sure that stays together in the conversation.
Okay, thank you.
Does that answer?
Yep.
Okay.
Okay. No other comments. So if we could just kind of send that grants policy and all that strategic planning, and then we'll kind of look at that, make some recommendations, and send it back to the board to
approved.
It's important that we probably start working on that sooner than later. With the grant window opening in February, the grant training happens in January. That means we have to have all this decided.
Yeah.
December is pretty much a hard month getting it done. November starts to lose momentum. Y'all start to travel, Terry Brown. So I need to make sure I capture you as I can so that we can go through process and be thoughtful in them. So I do want to make sure that
November 1st.
November
Yeah.
1st.
November 1st,
Take care of that.
Done.
Saturday.
We'll hopefully try
We'll
to
see
make
if
some
that aligns with the
recommendations at the
meeting.
next,
Yeah.
at the next meeting and kind of get on with it. So the next items, the North County Fire Protection District grant. So I kind of wanted to throw this on here just because like I think that it's been maybe a little open-ended and not exactly clear like what the relationship is sometimes. I mean, I think some of the stuff with the shared staff, never been a real big fan of, the ambulance. I think like we're supportive of, stuff like that, but I don't think it's been entirely clear to me the entire time exactly what the plan is and the long-term commitment that we have for, that partnership. So I don't know if you have anything on that or you'd like to kind of go over like what the history is or any of that, or
I can give you the history, but
Okay.
then I'll kick this over to you. So in 2019, this conversation was brought forward regarding the ambulance, which is a more probably clear cut. The closure of the hospital obviously has a large impact on North County Fire's ambulance process. As Chief McReynolds and Kevin, I don't know Kevin's title. It's Kevin and Keith to me. As the guys came in and talked about, their need for ambulance support is important because of the amount of miles that they put on those ambulances, the wait times, all of that. So the idea was North County Fire had this new burden because the ambulances were having so much more use with the closure of the hospital. So they came to the district and said, hey, can you help support a share of cost for half of an ambulance every other one ambulance each fiscal year for the next 4 years. And that was going to allow them to kind of catch up. This grant process ends in 2024. I know that Kevin has an ambulance that should be coming in. We should get the invoice for it for this year. So we're waiting to see what that will come in at, but we're looking at about $125,000, $150,000 expenditure for this year. Whether or not they can get caught up and get another one in next year, they're working towards that. That backlog is something that they don't have a lot of control on. Obviously, that one ambulance that got totaled on Christmas Day did not help the process. So they are working to put that forward as much as possible. That's the ambulance agreement. The second agreement, which has to do more with the senior medical services officer, if you can scroll down to the next one on that. Yep, a little bit more, and just perfect right there. The idea was for the senior medical service officer was able to support a missing gap, which was how the fire district could get some of these referrals to the Foundation for Senior Care because that's a long-standing program. Their overall fire in-house guys were having a challenge getting through those referrals fast enough. So by the time they got them to the Foundation for the door-to-door program, it might be 3-4 days, a week. At that point, that client has already been sent to the hospital, discharged back, and is already spiraling down again. Right. So the idea was that this would help to speed that up a little. The other part was obviously there was an interest in a mobile integrated health program, a telehealth capacity, continuing to support their AED training throughout the community. That part has continued. That has something Mary is still continuing to do. We haven't been getting reports on it, but we weren't asking about that. So I've got Kevin and Mary working on it now. I just didn't have the data for this. The other part was the Stop the Bleed and campaign, community CPR first aid training. We have been scaling that back up. obviously, in the midst of this contract came COVID, where Mary was influential for the district overall at a more county level, because the county decided that here they would send CAL FIRE and they would send our local county, our local district person out to county. So they kind of flip-flopped those roles on us. There was an integration of a lift medical transportation. Obviously that went on a complete hold. And then what happened is essentially that Mary became the primary trainer to get North County Fire's staff, all the medical staff, to a high level, so that on all those ambulance calls, they had the highest trained people, so that you had a mini emergency room, quote unquote, in that ambulance, because they had to go out of town. If you'll scroll to almost the last page on this.
Have they hit that goal? Have they got everybody kind of training now? It's maintenance mode, or is there still
It is constant training process.
New people.
as you get, yeah, but the process is in place and the training is happening. Okay.
One more. We'll break down this later. Yeah. So what we've found is that coming out of COVID, so we really only have about a year of solid use with Mary. Our agreement had been with them that she would provide no less than 4 predetermined health district sponsored events, and her presence would be at any joint community presentations. So there was never an expectation that she was a weekly presence, something of that sort. So what we've gotten from Mary and from the fire district over this last year, which is really the only data we can really even look at, has been sufficient. I've forgotten the number. I wrote it down and then I forgot it again. Sorry, Teresa. Of the number of sidewalk CPR trainings that we've done, not only at the wellness center, but that she has coordinated with Teresa at various school sites. They're continuing to work with the high school district, which is required to do some CPR training, to get that curriculum to the school. We're still pending the school and their process. We're ready to go. Their process is belabored. So they've technically been in agreement and compliance with the grant requirements as it was written. And again, theirs also ends in 2024. So that brings you, I think, up to speed.
Okay, thank you. So yeah, I mean, I kind of made my thoughts known about this a few times. Like, you know, I like some of the services. I don't think we've gotten a lot for our money, you know, to be honest. I've never seen Mary or seen her out in the community or, you know, seen her at a district event, you know, personally. You know, I would be more inclined to have somebody working in-house that did that or whatever than just kind of, I think it's kind of just a bad policy to pay for an employee at another district and then have no real say about what they do, and you know, not even have a real mechanism to figure it out. I mean, I've asked a couple times about like what she does and what, you know, and I mean, I don't really know, you know, so you know, that's kind of my thought. I think that the ambulance, and I think that I guess the greater relationship with North County Fire needs to be kind of looked at a little bit more strategically. And, you know, I think it's more than just buy an ambulance here, there, or whatever. I think that, you know, it'd be nice to have a more strategic discussion with them as far as like, how can we help each other? Like, you know, I mean, I'm maybe not happy with the way that the medical officer thing is going. How can we make that better? How can, you know, we make this so it works for us, or, you know, like benefits like us and, you know, long-term, like instead of just every year, like, you know, what can we do to, you know, help you? Like, you know, like a more long-term strategic partnership where both parties are getting something out of it, like, and feel good about it, rather than just like kind of throw some money out there and just kind of, hey, you know, like we're training some guys. I mean, I understand that they're going through some challenges and stuff, but you know, the reality is that people try to blame us or whatever. Like, we didn't close the hospital. Like, it's not, you know what I'm saying? Like, I don't feel like I have some responsibility to fund, you know, everything for the fire district just because like the hospital closed, didn't close because of any of us,
Right.
like, so, you know, it's a sad thing that happened, but you know, like it happened and we had nothing to do with it. You know, there's hospitals around and, you know, whatever, I understand and I want to support that, you know, and help them out. But, you know, I think that we should kind of look at it more, you know, like I said, a long term, what can we do?
No, may I make a suggestion? If we could get an update, from either our CEO, Rachel, or the gentleman, from North County Fire, as to a big picture of what they've been working on, because as I recall this, once we had the hospital go away, of course, North County Fire was impacted because they were getting the majority of the calls. And of course, as the community was growing, i.e. Camp Pendleton's expansion, the traffic coming on Mission Road was impacted greatly to where they couldn't even get out of town in an emergency unit. So they wanted to have another one on the other side.
Yeah.
And it was also to pick up those people who were discharged from the hospitals that didn't have a case manager following them, they didn't get their meds and didn't get their doctor's appointments, and therefore the Foundation for Senior Care stepped in as the case manager. And there was a talk about a rural medical program at the time too. So would we all work together? And when the resources weren't in full swing, then the development for this rural medical program was going to be explored further as well. And of course, we can't do without North County Fire in this community. It's absolutely wonderful. However, they're part of a bigger picture and they're all employees. We're not, none of our people here we're in it for the heart of the matter and the passion and the dedication to get these services out to the community. And we want to be cost effective. We're not a union either. So I do take your position with this is worth reviewing again and taking a look at what we're getting for this MOU. Maybe it is a worthy effort to continue once we have more information. But if we're not seeing that endeavor is being cost effective and the resources could be utilized elsewhere, then so be it.
Yeah.
Take it under review.
Mike?
Of course, I have an opinion.
We love that about you.
So as I was thinking through the strategic planning process, one of the things that came up for me was, okay, hospital, it's gone. We got the t-shirts, time to move on. What are the things we got to move forward on here from today forward? Because quite frankly, we're not going to do anything about it. I'm tired of talking about it. I think we have the story. Well, let's get the story out so everybody understands why it happened and what the economic hurdles need to change in order for another one to come in. Yeah. And until that happens, let's not talk about it. Yeah. The holes that we have are urgent care and obviously getting quick access to people in the community. I think what came out of this for me was a joint planning opportunity with North County Fire and us to sit down, really look at their 3-year, our 3-year, where are the holes and how do we help each other? Secondarily, urgent care. Are we going to approach and figure out what it would take to get an urgent care in the next 3 to 5 years? Is that an objective that we want to take on? There's financials involved, I know, there's people involved, can it be supported? There's all kinds of history, I understand that. But I think it's inappropriate to not at least have it sitting out there as a question. Mm-hmm. If not, what else do we need to do? And I liken this to an express lane to Temecula and an express lane to Palomar. How do we ensure that the ambulances that are mobile urgent care, and we may be there already, but that's what I was thinking about is how do we quickly get people in a severe situation to those 2 hospitals using North County Fire ambulances or Cal Fire, whatever the situation is. So as part of the strategic planning, that's another area of the plan that I think we need to specifically call out because that's always a question we're going to have. So thinking through how we can tactically put that into objectives for the next 3 to 5 years is important with them in partnership.
Yeah, absolutely.
We need them.
Yeah. Mike, thank you for that on-ramp, that idea of North County Fire. I think we had a good on-ramp with Chief 2 meetings ago where he gave us the big picture. He spent a lot of time with us and showed us the big picture. I think now the meeting of the minds, either with the 2-member strategic planning committee or the full board or whatever the chair decides on that, it's a good idea to sit down and have a 3-year look together. I supported and continue to support the idea of the ambulance support because it's the one thing we do that serves everybody.
Yep.
That having those ambulances ready to go the way that they've been described to us, it serves 100% when we need it, right? And also I reminded myself that the door-to-door effort and what the fire district does in the handoff, timeliness is everything, and that reduces the rehospitalization. And that's a huge metric for any community, is how many people are being rehospitalized. So whatever we can do to keep that metric up. So I support the skull session with the fire district, and that's just my philosophical stand on funding the ambulances. It's a 100% win for everybody.
Yeah. I think it helps address the senior operating officer, whatever the title is, but getting the nuts and bolts of that too. What is going on? What is happening? You know, so we're all clear on what that is.
Yeah.
I think Terry's unmuted. Oh, now Terry's back.
So can you hear me okay? Yeah. My sense of it is that our relationship with the North County Fire District is one that we are definitely living up to our end of the arrangement by passing around a lot of money to them, which I don't begrudge at all. I agree with Jennifer with regard to the ambulance service. I think that's our mobile ER room, since we don't have a permanent ER room. And the more we can support that, I'm totally in favor of that. The other services, i.e. their outreach person, I agree with Bill in that I don't think it's meeting our needs. So let's get together and, as Jennifer said, have the skull session and realign what we need to do with the North County Fire District.
Memory's going on.
Siri's got some directions.
Does she get a vote?
Ready? Well, yeah, if we could maybe try to set something up, you know, maybe just a couple of members, a couple of areas.
Sure, yeah, I'll reach out to Keith and see if whoever chairs their strategic plan. We'll get to maybe their strategic planning and our strategic planning. Schedule.
I think that'd be good. I think that would
I know.
working out. I definitely think that if we need, it's a good opportunity where we both can get more out of it.
Put it on the table, Talk it up.
Invite her.
Perfect.
Oh, yeah.
Let's break.
Yeah, let's go ahead and we'll take like a 5-minute break.
Do you have a question or?
It's not a question, just a real quick comment because we work with Mary. I had asked my advocates the other day, I said, so besides Mary bringing us the referrals, what else does she do? And I said, is she helpful to it? And they said, oh my gosh, yes. And I, well, like what? And I said, well, if we have like people that are constantly going in the hospital, the revolving door, there are times when a certain hospital does not serve them to the best interest. They really need to go somewhere else, but the fire department doesn't know that. So when we run across those and there's a particular person that needs to be seen at a different hospital, we work with Mary and she makes sure that the fire department and the people there know, hey, we can't take this person there. We need to reroute them to a different place. And she also, I know they said she recently coordinated Hoyer lift training for a family. And then that they were struggling and their caregiver was struggling to figure out. And she actually said, well, why doesn't our fireman who use this and know how to use it, why don't we come and train her and the caregiver how to do that? So she saw a need there in a way that they could solve it. So they said that they work with her all the time, that if there's a particular client that has a special need that they need to keep informed, she's their liaison. So I just wanted to give you a little bit of insight on how we use her besides the referrals.
Thank you. Appreciate it. All right, we'll take a 5-minute break.
Sure, perfect. Yes, thank you.
You know what? I can't.
So we'll get back into the meeting now. We're on to discussion item B, community health and wellness center services and programs. Rachel, do you want to?
Yeah, I'll start that. Do you want to bring up this one? Yeah, we're not keeping the current program there.
There. Programming.
That's the one.
That's
So, before I turn this over to the wellness girls, who really are the ones who have all this detail. The reason that this one is on here is that, again, our current strategic plan. Our current strategic plan has been what we have been following in deciding what and how many programs are going on at the wellness center and such. So your strategic plan and your current programming matrix should sort of help guide and align each other a little bit. With that said, before I turn it over to the gals for them to kind of look and be able to discuss that, I think it's important that we're talking about priorities and then future programming so that we aren't doing a scattershot format of programming. And again, this leads back to our future of strategic planning. If we're looking at 3 and 5 year goals, we need to start talking about what kinds of programs fall into that versus what are just programs of opportunity, right?
Right.
We've spent the last year working to side by side fold in as many programs of opportunity as we can that are relevant, as well as following our catalyst plan that fit with the community needs assessment so that we were addressing the primary health needs with some of the best programming available. And then the next step, I think, as we move forward for this next year, is identifying, do we have additional priorities? We want to stay on this path. And then a future programming, if there's expectations there. That is the entry point for me over to the matrix. So Teresa, Bianca, if you guys want to just briefly walk them through what you've got on this matrix as far as our current programming, explain a little bit between that difference of what's district sponsored versus partnered. And then we can talk about what's upcoming and in the works as a second part of that conversation. Is that good? We did rehearse this part.
Well, you do the first, why don't you do the first view because that was.
Okay, so moving from left to right under current programming, you'll see the district sponsored events. As it was mentioned earlier in the meeting, district sponsored events are events or programs that we initiate, that we are fulfilling, that we're staffing, that we're implementing, we're tracking everything from the participation in those, we're tracking feedback loops, ensuring that we are having the greatest potential for success in each of those individual programs. At the top, you'll see our mental health first aid. As many of you know, we did receive an acknowledgement and an award recently, as being amazing and stellar. We have mental health first aid being scheduled throughout this whole coming year, from helping military families to youth and elders, seniors, mental health concerns for seniors. This is a really great collaboration, and we have people already asking, like, when is the next one? We've been able to have those programs include nurses, students, staff, and I'm really looking forward to doing more outreach to whether it be first responders or teachers to participate in the other mental health first aid classes. And it's a certification class, 8 hours long, and every one of the staff members of the district participates in this mental health program. I've done it, and even though I've got a background in EMS, learned plenty from this program, especially the resources that are available here in San Diego.
Love it. We've trained over 120 people in mental health first aid in this past year, and we run over 11 programs to date. And interesting thing about this is there's a lot of interest in the community. So although we've trained 120 on my interest list of people who have provided their emails and registered for the program, is over 240. So there's a strong, interest in the program.
Great. As was mentioned in a previous meeting, we have our lifestyle change diabetes prevention program. It's fully launched. We are at capacity. 20 participants already have an interest list coming for the next cohort. And also our relationships with our local medical providers, referrals are starting to come in. And as taking a pulse of all the participants in the program, so jazzed. Like I went ahead and called each participant in the program. How is it going for you? Are there any things that you would like to see added to this program? Any concerns? How are you doing with it? And they said, it's so amazing the friendships that I'm building, and I'm feeling really motivated. We have people that are even meeting outside of the program, doing their own walking groups. We communicate via email. We've got our own group texting platform. It's going really, really well. Our demographic, we have male and female, youngest in their mid-30s, all the way up to 80. So we're hitting a massive demographic. We've got Asian, Latin, across the culture. And so, or cultural demographics, I should say. So it's been I'm really optimistic for where this program is going, and we'll provide, all of us with reports on its successes.
The marketing was great on this, and not only do we have around 20 people, which is the max for the program, we had over 40 people interested that we had to weed through, that either the time commitment was too much or they already had diabetes. So this is an example of a go deep program. So this will impact people's lives. This is a program where it talked about 10 years out, 50% of the people maintain not developing diabetes. So this is, in terms of, there's some programs that are more, sub-level, maybe it's a workshop. This is, really a go deep, which Bianca is doing phenomenal with. It takes a little bit more time, but there will, be a big impact in these lives.
It's not a little bit more time. It is a lot more time. So let's be clear, when we start talking about demands on staff timing and a go deep program, as you said, this is a deep program. So right now, Bianca's meeting once a week with all of these groups. So not only is it the time spent in that actual shop, but the prep for it, the follow-up for it. So that is a deep investment. This was, to remind you all, the #1 program and project that was called out from our community needs assessment.
Has the resource load been higher or about what you expected?
What we need to put into it, you mean?
Yes.
It's probably a little higher. I don't think we understood all the various certifications and trainings it would require for this to be qualified as the CDC's level of programming. The team is hitting it out of the park. They're managing it. It's not a problem, but it is intensive. Okay. We're also in the, as Jennifer likes to say, we're on ramping. Once it's built, it will move much more quickly.
Sure. Okay.
So I'll let you continue, but I want to make sure that we clarified the depth of efforts on that.
Yeah. CDC reporting is very thorough.
That's one way to say it.
Maybe my reporting to the CDC is very thorough, and their expectations are
right there.
Yeah. Community Collaborative for Health and Wellness. This is one of my favorite outreach programs that really targets our grantees and the opportunities that we have to collaborate with them. I would love to see all of our grantees participate in this program. We have Foundation for Senior Care is always there. Michelle's Place is always there. The school district is always there. Boys and Girls Club is always there. We have a number of grantees that don't show up. And in our last meeting, and why this is so important, in our last meeting, we're sitting around in a circle and I asked the question, from these meetings, how many of these participants have called each other in the last month to collaborate or provide resources? 99% of them rose their hand.
We're doing some massive cross-pollination. We're not reinventing the wheel. We created this whole organizational mapping system of all the resources that our grantees provide and all the resources or the empty areas where we need help. And we're able to pull our grantees in to collaborate with each other. And so I can't reiterate like how important it is that our grantees that are receiving these grants are leveraging the resources that are made available through our community partners in the CCHW. It's awesome.
So that becomes potentially a grading criteria if we were to grade the grantee peers. Somebody who's willing and able and doing those types of things would elevate them potentially as a more higher level.
Yeah, we could bring that into the grant process.
Yeah.
We would follow up on that.
Right.
It wasn't at one point at least a requirement for them to participate.
Technically, it is still in their contract with us if they're participating.
Yeah. But is it the same groups that don't show up every time, or it's just kind of sporadic?
It's pretty much the same.
It's the same.
Okay. Well, that's, I mean, something we can look at or whatever for sure.
Up the ante.
Yeah, I mean, I think that, you know, at the heart of what we do, I mean, that's what we're looking for is groups to collaborate with. And the worst that we could do is provide some program that somebody else is working on, or, you know, like that's not needed, or, you know, so I definitely agree. It's good to see that for sure.
And there are some participants who aren't grantees,
Yes.
like
Many.
Cal State Nursing
Yeah.
School. They're not a grantee, but they're there to network. And
Yeah.
the ones I've gone to, Bianca, it's been a full house. So if you had more people there, it would be like this.
Yeah.
So there are a lot of people who show up.
Yeah, we will have upwards of, 24, 26. We have a number of organizations that are coming, just this past week, we have an organization that's coming in all the way from Vista. And so as I'm thinking about networking and leveraging the CCHW to serve our region, this is a really great way to plug in because they are receiving things from it.
Yeah.
Cool. And it is something that organizations tell other organizations, and somehow Scripps heard about us and they sent a representative to the meeting this past week from their diabetes center.
Oh, nice.
Yeah.
And that also allows us to leverage the resources that other organizations have
Yeah.
to plug in, and then allows our staff to maintain our ability to fulfill our obligations without, overwhelming.
Yeah, for sure.
Fantastic.
And the CCHW is a long-term legacy program, so I'm glad that they put the founding date. We've been running this program since 2005, and it has had some growth and some shrinking, and now it's back to a tremendous growth. And it has evolved from some of the provider breakfasts and things that they did back in the day to now a true solid working networked group. So,
and if I may say, it was out of that group that the grandparents parenting grandchildren support network started and now is funded as a program. And it's a seedbed of great ideas. So
yeah.
Absolutely.
Okay, so that we've been working with the San Diego Blood Bank, and for over a year, we have been running blood drives every 8 weeks. So that has been a great program for the community and helping the blood bank as well. So we always max out the number of spaces. We always hit our target every blood drive. So that is going strong. And then I'll go ahead and do the Wellness Wednesdays. Our health screening event, we rebranded it this year to Wellness Wednesdays. And what it is every month we have either the San Marcos nursing students or Fallbrook Family Health Center come and provide screening. And then we have a different organization do some education. Sometimes it's on a monthly theme. Sometimes it's been related to lifestyle change. So, but every month we offer that. We changed the time this year to 12:30, hoping to get a few people. It's as early as the nursing students can come, but a little bit during lunch, maybe to pick up some people during lunch. So the time of day is a challenge. But that being said, we do have people coming. We would like the attendance to be more for that event. That being said, it is usually our most popular social media posts. So there is an interest around it. as we can. This month, May is Better Hearing Month. We're also offering hearing screenings. There's another month we're offering vision and dental screenings. This month is mental health. Our topic is adverse childhood experiences. So they're quality, presentation and topics that we run each month. We also have information. So you get screened blood glucose, blood pressure, and BMI. And then there's nurses with an information table that will then kind of give, some more background on what this means for them. Then we promote our own resources internally and have other partners like Michelle's Place, and depending on the topic. So this next one is going to be, the next month in June will be the Narcan education. We called it Narcan 101. So it's going to be information and training provided by Mary Murphy. As well as On Point will be supplying Narcan. We've encouraged all of our community partners through the CCHW to come get trained, and then they will be able to receive Narcan.
And as a reminder, Narcan is the reversal drug, the fentanyl component. We also have, I think, fentanyl test strips to provide to the partners at that event.
On Point will be providing those.
Yeah. So the idea is that becomes a train the trainer event.
Yeah.
So we'll bring in the resources, get the resources to the partners, and then they can do direct care or distribution to their clients.
Recently at our CCHW, a few of our participants, because we've been really encouraging them to come, to that event, and they shared how grateful they were that we were doing this, because the closest place that you can actually go and retrieve any kind of Narcan was in Oceanside, but they're having a hard time getting the resources for there, and they're having to go all the way down into San Diego. So us being able to provide that, to other organizations is a good thing. Yeah.
And if I can just make a quick comment, my daughter, she went to prom last weekend, and just at the prom, there was a kid that passed out, and it turned out to be like a fentanyl opiate sort of event or whatever. I think that the kid ended up being okay, but it's so prevalent, you think you go to the prom and it's all good or whatever, but even there, high school kids, so. It's definitely makes a big impact when we can provide some of those services and, kind of try to prevent some of that for sure.
So CPR trainings we've been running, we did them a lot last year. And as we did more of them, because we were doing every month, the attendance went down. So we're in the process of revamping that. So as when we talk about Mary Murphy, we alluded to the fact that we've been working together to try and get a program in through the junior high, Bonsall High School and Fallbrook High School. So that's still, we've done all of our part, but that's part of also building up the CPR training to drive more attendance into the wellness centers, because if the kids are doing it, then maybe, and talking about how easy it is, maybe the parents will be as well. But for this summer, next month, we're working on a program in collaboration with North County Fire. That's going to be kind of like CPRs related to pool safety with summer coming on. They always do some education on that. So we'll be doing some trainings in the evenings, because we are now one evening a week open and staffed until 7 o'clock at the wellness center. Not that I guess we forgot, Katya, community resource navigator, should have been under it. I just realized that she's not necessarily an event, but she is one of our programs. Not an event, but so I'll just throw in that kind of program is going really well. She's had over 20 clients, and we haven't even really fully, launched her. She's going to Vallecito schools once a month to meet with families there, and as well as the food pantry to start, bringing in some resources there. And she will be available for later hours on Tuesdays, so working people could be able to access, her programs there. COVID at-home test pickup, it kind of over, but we are, just the other day someone came to pick up test kits, so we are continuing to offer that to the community, and staffed and organized for that.
That'll be until the supplies, and the CDPH has already ended that program, so the supplies we have left are the end of it.
Yeah. So come the end of this year, we're going to be planning a recognition. We have a lot of wonderful organizations and just good community members that are sharing their talents with, you know, and educating people at the center. So we're going to do a little recognition event for them, like a holiday event to recognize their contributions to the community. We do tobacco cessation program. I don't know if you guys knew that, but it's called Kick It California. So we have resources available, and our staff's been trained on it. That's part of our Wellness Wednesday event as well. But it's a packet that puts you in touch with a coach to be able for free that will help you quit smoking. So nice. Yeah. So I'm gonna have to leave in a few minutes just to let you guys know.
And I don't think we need to go through each column specifically. The district sponsored events are the ones that are probably the most important because it requires a lot of staff effort. The partnered events also take a lot of effort, especially the scheduling.
Yeah. I guess that would just be I wanted to be sure to make this point before I have to hop out, is that we're like at a point to make decisions about programmings, because bringing on some of the individual community member that has something great to share takes a lot of time to go through the onboarding, the qualifications, to bring that versus putting that time into some of the more disease-orientated programming that was called out in Catalyst, a program for, you know, hypertension and heart health, or programs for arthritis, you know, these different, you know, diabetes self-management, expanding on that. So we're kind of like at a point where if, you know, we're going to need to decide where to put in, you know, that level of our energies and what the priorities are when it comes to this.
And is space also an issue? Space?
We're getting there. Yeah, we're getting there. And depending on what happens with the PACE center, you know, that will kind of determine things as well.
Okay.
So before Teresa has to head out, Bianca will stay with us as we finish the rest of this conversation. But to Teresa's point, we started it with like, hey, you want to offer something here? Great, come on in. What's your certification and can we get your insurance? And that was kind of where we started. A lot of those things sort of naturally fell off. Some of them have evolved a little bit more. It built a lot of energy and new voices and attraction to the center. But now is the time where if there are specific priorities or directions that the board would like to see that is outside of the Catalyst report, we need to kind of know what those priorities are in a very short order so that we can start to plan where they'll fit as they come up or what we pursue. There's only so much more time we can pursue new programming. So if we're going to put energy into that, we need to make sure we're following not only the Catalyst report, where we know that we've got data that shows it's important to the community, but things that are important to the board. And I know, Terry, I'll direct this a little bit your direction. I know that you expressed an interest in having some Alzheimer's dementia support. In the matrix, you'll see that that is already in the works. That relationship actually came up as part of the CCHW relationship that Teresa made a good connection there. So that's coming, but that's a perfect example of that's an interest and priority for a board member. You all may have something like that. And while we don't want to just throw random items in there, you know, rock painting is fun, but not necessarily a help group. We do need to make sure that we're having that conversation so that we're building that into the potential matrix.
Is there a time in the year where that needs to get done?
Now.
So, but is it a specific bucket that we talk about?
No, it's never been done before because we were never here.
Budget bucket things, right?
Well, it's not a budget bucket thing because the budget's already done. But so to your point a little bit, we're creating this framework for strategic planning in this new process, so that we can start to examine how it works. I would venture to guess that for the 24-25 fiscal year, we would need to have some ideas about it for probably the fall.
Gotcha.
That would allow us to investigate something so that if there is a financial, we can investigate it, get it to finance, get it to board, potentially get it into budget.
And related to that is if a program is capping out and growing and needed, going deep versus depth is another conversation, right? that we have to have
Exactly.
in that. Okay.
Right. And make, oh, sorry, go ahead.
I know you've got a scoop. I think, I don't want to hold that up. Can you tell me, like the Qigong and the chair yoga, what is our relationship to them? Do they pay us rent? Do they take money? Do they charge a fee? How does that work?
Yeah, so currently, the instructors of both the Qigong and the chair yoga class, they do not pay us rent. They use the room for free. They are requesting of their participants a suggested contribution. I've moved them away from utilizing the word donation, but it's a recommended contribution. And in communicating with a lot of our instructors, you know, including our yoga instructors, you know, when gas prices were going really high, it was becoming next to like their ability to come out here and do the class was being impacted. So, and that's a conversation for the board to have as well.
How many people roughly show up to those type of things?
20 to 25 for the chair yoga. It's our most popular class.
Yeah.
For Qigong, 6 to 8, maybe 12 at the most. Qigong is a relatively new program. I don't see it. Yeah. It's yeah, I don't know that it would grow to the point of yoga interest, although the yoga instructor and the Qigong instructor, it's potential that they could collaborate even more so together.
Okay.
So they get paid?
No.
None of them get
They-
paid. So
they-
it's a
they can
voluntary, they're just volunteering their time for this.
And whatever suggested contribution a participant makes to them.
So you could come for no cost, or you could give them like $5.
Gotcha.
You know, at a time. Yeah. Okay. So before I head out, I did have one thought in looking at all this and thinking about the programming for the future. There is an opportunity to put like our stake on a particular health risk, like perhaps maybe diabetes, like that we could have a rallying cry for what we're doing for the community. Like, you know, when we have the hospital, it's easy to say we have a hospital. You know, this is what we do. What do we do now? Like, what is happening at the Community Health and Wellness Center? And one thing could be something like diabetes or heart health or lifestyle disease. There's a chance as we look at the priorities in our programming for it to connect with our communication to the public and our branding and, you know, raise our visibility in the community and what we're really accomplishing. So just, you know.
Yeah,
Kind of the tagline.
Yeah, and I appreciate that notion because how we're thought of matters. My initial response to it is I don't want it to be about one element of risk because we're not that. So I don't know whether it's, you know, healthy life, happy life. I don't know, but I would not support a given condition as our tagline. It's just too limiting.
Yeah, so for me, I really like a lot of the programming and where it's going. I think that, we spent a lot of money on that catalyst report. I'd kind of like to, use that to kind of, in 3 or 5 years, we can go back and we can look and see what other sort of needs there are. But I mean, it seems like the programming, it's pretty diverse. I mean, it's hitting older people, younger people. I mean, there's a lot of different things going on, and it's nice to see the facility being used. I think for me, one area that I would be interested in seeing is, more partnership with maybe the school district, maybe something where, the class comes out to learn about, diabetes prevention or nutrition, or, I think that's probably more of a long-term thing, trying to partner with them on, I don't know if a certain grade level would be appropriate or, but once we get the facility kind of built out, I mean, it's a good opportunity to kind of partner. And I know that they partner with, other groups for field trips to look at stuff or whatever, but I think it'd be a good opportunity to kind of, get them early and kind of, utilize that partnership. But I mean, I think personally, like, my thought would be like, I don't know if we need to have like a window annually where some of the new ones can apply to be you know, a grant or to use the facility. I don't know if that would be easier for you guys. I would be good with you, like staff kind of looking at it and, you know, knowing our priorities, I guess, and then seeing which programs aren't working and just limiting their time or, you know, I think that,
that's kind of.
you two are probably the best on the pulse as far as what's working and what's not, you know, I would hate to get in your hair about that, you know, I mean, if there's programs that aren't functional or we're not getting enough participants out, I mean, I would be good with, you know, staff just kind of figuring that out or whatever. I mean, like I said, I think that the priorities that we have as far as, you know, the programming, it's fairly clear. There's a lot of different priorities, but you know. That's kind of my thoughts. I don't know. Terry, do you have anything on this?
Yeah, I guess my question would be relative to those outside vendors or services that we're inviting in, which I think is awesome to do. What is our request of them for their insurance, certificates of insurance? Are we asking to see COIs on any of these people?
Yeah, we actually have all of those insurance pieces built in so that we're named.
San Antonio and downtown.
The program that's also being offered, the instructor has to provide us with something that indicates that they are skilled at what they're offering. They can't just say, oh, I'm an expert in, you know, tea making and can show up. No, they have to actually provide us with their CV or something that demonstrates it. Then they have to bring in all the assurances piece. We spent a good solid year going through that. I know we sent some stuff to Jeff. And
use the right lane to keep right to iPad.
Teresa has on the website, anyone who's an individual agency ability to get insurance, there's a whole separate way that they can do that through CS or SDRMA. So there's a number of things where those risk management pieces, those were covered long before we opened the doors.
Awesome.
Okay.
Anybody else? No?
Any questions?
I guess I just have one question while we were going through it. I know we do the CPR training. I was just wondering, is there some reason why we can't offer a certificate once they do? I mean, I know like for me at my job, I had to get a CPR training and cert or whatever, and you know, it's the same thing. I'm not sure if that would be more of an incentive to try to get people in.
So the full CPR trained where you end up with a certificate, there's a nominal cost to it. It's a much more in-depth. What we've been doing is essentially keeping a little bit of an interest list. There are several providers in town that also offer it for a fee. There's been a balancing conversation. We indicated from early on, we would not compete with some of our local groups. Yeah. Those groups that offer that for a fee, we want to make sure we're not competing with them. But secondly, if there's enough of an interest group, we can have either one of these vendors or any number of people come and actually provide that full CPR certification class. Yeah. The overall interest for it for a one-off person doesn't make sense for us. Yeah. But if we get a big enough group to do it, then we have the resources to that level.
Yeah. There's also kind of another involvement with it in that the American Heart Association is moving away from the certificates for community trainings. The reason is because when your certificate has expiration date on it, then people feel like I can't do CPR because my certificate. So they've moved away from that. So what we're offering there is to be more community wide. Like, hey, you see someone drop on the sidewalk, I know what to do. I can do chest compressions. Also moves away from the mouth to mouth. That was another thing that was preventing people in an emergency situation from providing the CPR. So that's
why it's called sidewalk CPR.
Yes. Yeah, exactly. Yeah. Exactly.
Hands only.
Right. Thank you.
Bye-bye. Bye-bye.
Thanks, Teresa.
Nothing else on this. So I mean, I don't know if we need to send that back to committee, but
not really. This was more, again, just more informational. I wanted to use this opportunity to gather any information for expectations on future programming. Obviously, this is a dynamic process. And Bianca keeps bringing things on to her board that she would like to see happen. But we also want to make sure that if there was a specific passion that any of you say, we aren't hitting this, we aren't teaching that, this was a time to start bringing that forward. We had that time to start investigating. And to Mike's point, we can build in a process in the future where each year there's some review of some of those programming.
Is there any tie-in for the community health, community hours that students need to do? Is there any opportunity to fill some gaps?
You mean their volunteer?
Volunteer hours coming into help any of these? I don't know if there's even a fit.
I can speak to this.
Perfect.
And I love the community service requirement. But we manage that through the Fallbrook Arts Group. We have them come in and help. It is so intensive in managing it.
Yeah, I was wondering.
It's just, you gotta locate, you gotta see,
yeah,
you gotta have, mom gonna drive me. I mean, it is cumbersome.
And with the large number of nonprofits in this community, there is no lack of opportunity.
Okay.
So it's not as though somebody doesn't have an option with us.
Yeah.
I can imagine in our 3-5 year from now, there might be opportunities. Right now, it does not make any sense, to Jennifer's point.
Yeah, I'm thinking about like for the nursing students, before they were nursing students, they had an interest in this.
Right.
At some lower level of education. Is there an opportunity to help seed and grow and accelerate some of those channels of opportunities and professions?
We could literally redirect them to, there's some different health focused things that the 2 high schools do.
Right.
There's a specific thing that happens at Palomar. There's a specific thing that happens at San Marcos. So we would fit them to those existing channels.
Gotcha.
Yeah.
Cool.
I just wanted to add a couple of things about Catalyst. The reason why I actually really appreciate the Catalyst report and the suggestions that are made for the organizations for us to leverage as a health district is each of these suggestions are evidence-based programs. Right. And that's something that in implementing those programs automatically ensures that we are not competing with community members that are offering similar things. Mm-hmm. And as a health district, the quality of education that we provide, there's a level of responsibility that we have to make sure that we're providing the highest quality to our community members. And so we can have, like, for example, we can have, our diabetes program is very thorough. It's very thought out. We have a number of other programs that may happen or are slightly different, but this allows us to provide a higher quality, education and opportunity to our community members that are otherwise not available, with exception to maybe in San Diego or maybe in Los Angeles. And so I just wanted to speak on behalf of Catalyst and why it's so important. It's really high quality programming.
Thank you. And just one last thing, I was just kind of thinking of the AED thing. I don't know if we could kind of work that in with the CPR trainings and stuff. I think that's another area that, we could potentially hit as far as just providing training.
Oh, that's part of that training.
Yeah.
Yeah.
Okay.
It's built into that training.
Awesome.
Yeah. How to use an AED if it's around.
Yeah.
What it does, what it doesn't do. It teaches you the triage, who's doing what. We're all standing around looking for somebody. Somebody jumps in, you make the call, you're doing compressions, you're doing this. I mean, it literally does that whole process training.
Yeah. Good deal.
I mean, we'd be happy to have Mary come in and do that training for the entire board.
I mean, that'd be great.
I have my card.
The idea is.
I didn't see.
Yeah.
I did the 8-hour training.
But what would be nice is to be able to visualize what that program looks like that we're submitting to the community. So we could offer that to a lot of the boards of directors for the different nonprofits, because that is one of those groups where you have a diverse population meeting together. And God forbid something had happened.
Oh, we've already had it happen at the Art Center.
Right.
Somebody dropped, they were literally dead. And the AED came in and the 911 was there and they survived even though they were in a state of coma for 3 weeks. It was bad.
Right.
But he rose again.
Nice.
So yeah, I mean, I anything that we can set up that provides more opportunities to train people in the community, and I think I mean, just like that situation, I mean, we're talking about actually saving people's lives, like when something happens, and I mean, the more people we can kind of empower to do that, I mean, that's obviously a positive thing for us to do as a health district, you know,
Right.
as direct as we can get about benefiting somebody, so.
Do you want to take this opportunity to do a lunch break, since we have lunch as well? Give everybody about half an hour to grab some food and restroom, and then we can power through the last couple sections.
Yeah.
You guys
I'll put
good?
it on the agenda.
Is that good with you, Terry? You can't have any food, but you know, you can take a 30-minute break.
Hit the drive-through. Chick-fil-A.
Okay, all right, we'll take a break. Let's try to adjourn until 12:25, and then we'll kind of try to power through the rest here.
Perfect.
So,
Are we tracking okay?
Yeah.
Agenda-wise, good.
Yeah, we're doing good. We're actually a little bit ahead of the schedule, I assume.
Cool.
all right,
Right.
we're on break.
Yeah.
Yeah. Oh, yeah, we're still going to school for veterinary stuff.
We're gonna get back started. Okay, so back to the meeting here. We have a couple things left here under the item B still left to kind of hash out here. So I'll turn that over to Rachel.
Okay, I'm bringing this forward from the most recent strategic planning meeting. This is in reference to 2 potential MOUs that are coming forward. You'll see this at the June board meeting, so that it's not an action item, but as a good example of following some of our MOUs, following some of the interest in ongoing programs. So we had 2 put forward. First, we have from the Gary and Mary West PACE, a proposed community senior health and wellness satellite clinic. They have put forward a newer white paper draft proposal. If you'll recall from previous, what they were looking for is to use the 2 back classrooms of the wellness center to create a senior PACE clinic, if you will. And the initial proposal had been, they would offer it for 2 hours a day to any senior who wanted to come in, whether they were a PACE participant or not. They went back and ran some of their numbers and realized it just doesn't make sense to only offer it for 2 hours. So what they wanted to do is they would be there 8 hours a day, Monday through Friday, with a rotating set of different services. So it would be manned every day, but the services would change, which is what you'll see in the spoke and hub style at the bottom of those different kinds of services, but it would be staffed. So what they'd like to recommend is that they would be there 5 days a week, 8 hours a day. We would obviously negotiate a lot of these pieces, including maybe some of the times of the day, so they could be open a little bit more in the evening. In exchange for being there the 5 days a week, they would have it open for 8 hours. Any senior 60 plus could come to the clinic. If they're a PACE client, that's great. If they're not a PACE client, they could at least start to a little bit triage them. Perhaps they would flip into a PACE or PACE. PACE is the...
How do you get to be a PACE?
You have to be eligible. There's a financial component to it. And basically PACE would work the documents as far as your Medi-Cal or Medicare insurances.
And what is the criteria to be a PACE?
We're
That
gonna
matters,
find
because
out.
how many PACE eligible people do we have in our service area?
A very large number.
Yes.
But
It's a
I-
Medicare program.
Okay. PACE is a Medicare program.
Okay.
And what happens is a group like this takes on just like an HMO.
Right.
They are basically their own HMO.
Not
And so,
Medi-Cal though.
No, they can serve Medi-Cal and, well, you have to be Medi-Medi or you have to be Medicare.
yeah, and so you have to be low income in order to qualify for it.
There's an income
There
component.
is an income component.
These are all
So-
important things.
Yes, it
Right.
is. It's very.
So that's why this is just coming forward as informational. It's not an action item. So,
We're gonna go look into it.
yeah, we have a tour scheduled, with the
You're going.
with the San Marcos one. I just sent out an email on that. So, but what they've done is they've put this forward that in lieu of rent, so they're asking for rent free. to be in this space, and then they would offer these clinical services to any senior who's not a PACE, and then obviously their PACE as well. They have already contracted with the Foundation for Senior Care to have that as an alternate care site for their day programming, which is what they offer in San Marcos, but which has been a little bit geographically challenging. So that is one of the things that you're going to see come forward. They're very interested in also working with North County Fire to set up a little bit of a paramedicine program. These are some of the things that you're seeing a lot of the different communities doing. Terry had referenced an interest in it back when we were talking about,
Where is he?
Terry has dropped off. He hasn't popped back on yet. This is what Grossmont has kind of been, not Grossmont District, but has supported through the county.
Yeah.
These ideas of some of these clinics where there are paramedicine programs that can go out to rural areas or homebound folks. So PACE is looking, Gary Mary West PACE are looking to try to support and grow that out here as well. So that's been brought forward as one of the potential MOUs that you're gonna see come forward.
This is fantastic.
Yeah, right. It's a great opportunity. So that's one of the pieces that comes forward. This one doesn't have a cost to us because they're looking for no rent.
Right.
So we wouldn't actually
In kind.
create a revenue stream from it, but they would offer services.
Right, and I asked them about how they would administer the services, and they indicated they had a mobile unit that would bring out, and they would take care of vision, dental, etc.
Right.
Wow.
So that is part of what you'll see come forward on that.
So is there some point where the opportunity cost of that space being used there versus other programs that might generate revenue? At what point is there a component down? I completely support this, by the way. But as it gets successful and we grow the program and we start getting capacity constraints for the other programs, at what point do they kick over and maybe start funding?
That'll be part of the follow-up of section C here, is that in our agenda today.
Gotcha.
The idea of, and we've had this conversation at various iterations of the board, what is the expectation of the center generating enough revenue that it's sustainable of its own, versus we want this to be there enough that the in-kind not generating is worth it.
Sure.
And that's going to have to be
balance.
a strategic conversation.
Yep.
Right. All right.
Can I make comment on that? With the PACE program, when they're entertaining people who don't have PACE, they have the opportunity to convert them to PACE, which means then that they have increased their income. And once they start to increase their income and their numbers of PACE, which may be a level at which you say, well, if you have 25 PACE from our area here, because many of the people here who are low income are interested in PACE, but the problem is there isn't one in the area, which means they still have, as an HMO, they still have to go to Vista, San Diego, Encinitas, places like that. So it may be at that point, you say, okay, PACE, now you can afford, we have given you this revenue. And you know, that might be
so that's one of those categories where the seed is coming, right?
To Bonso and go out to Rainbow and go out to Duluth.
Potentially. So I will also let you know that I just engaged in conversation with St. Paul's PACE Senior Services Program. So I'll be having a follow-up meeting with them to see, because they are also interested in doing more work out here. One hallmark of the St. Paul's PACE is the fact that they do a very strong collaboration with home building, specifically to bring affordable senior housing. So I think we're going to see partnerships with PACE out here, whether it's this PACE, that PACE, we don't know, but this is the first proposal we've had brought forward for an interest. So
can I do a little bird walk? Just a little. So Jim Desmond had his town hall meeting last week, the week before. Anyway, one of the things he announced was that the county, did I already tell the board this? The county has identified the site between the Boys and Girls Club and Alvarado Did I already mention this?
And they're gonna put in
Yeah.
40
Okay,
units?
and 40 units of affordable senior housing, so I guess that's another indicator of how much need there will be for something like this. I was trying to connect.
Yes.
Okay, I'll shut up now.
Yeah, so, for me, I think that obviously it's a great program. You know, I think in the past, we've been looking to fund programs like this and the opportunity to have them provide the services here. I mean, for just the space, I mean, I know I personally had multiple discussions about that place back there where they're requesting being some sort of clinical services too, so I mean, it's obviously, it's not an action item right now, but I mean, it seems to me like, I don't know really what the downside would be. I mean, it seems like a positive program, and obviously in the future, we'd have to look at, you know, but I mean, we wouldn't be looking at any sort of indefinite agreement. I mean, we could come to agreement with them for a whatever duration, and then, you know, kind of move on from there. But I think that that's a big component of what we look for, is some sort of clinical service provider that can kind of work with some of the other groups and provide some services for us.
I agree with you, and then I think the high utilization capacity of the site helps build the need for the site and the improvements needed for the site.
Absolutely.
When there's a draw and a demand for it. You know, that's a good message.
Yeah, there's no point in building out an empty building.
Exactly. Right.
Absolutely. So, I mean, seems like a
Beautiful.
good deal.
So-
Looking forward to seeing that on there.
These are the types of MOUs that I am pursuing. So while Teresa and Bianca are hands-on getting a lot of these programs up and running, we're going to still be researching these potential service providers to fill in the various gaps that we've all identified through our grantees, through Catalyst, all of that. The second one that is brought forward from Palomar Family Counseling, and Lisa's on Zoom. So Lisa, feel free to chime in after I present this. This resulted from a conversation I had with Lisa and her team. Palomar Family Counseling, you're all familiar with it, at least to some extent. They've been providing services through school-based primarily, and then the Grandparents Raising Grandchildren program that we fund as well. One of the biggest gaps in care we had here that was identified by Catalyst, and that was really self-evident post-COVID, was the lack of access for mental health services. So my conversation with Palomar Counseling was, what could they do to expand? Now they have a site and they're involved in the schools, but both of those sites are pretty full and are not open for just general public to come in. So what they've put forward here is that we would provide essentially kind of like 2 therapy rooms at the wellness center. They would be able to bring in either licensed therapists, associate therapists, or graduate interns to offer individual, family, and group counseling services and wellness workshops at the center during fixed times during the week. And they would work obviously with our team on scheduling and such. So what they're proposing is a gradual build up of services. So first quarter, they would provide essentially 1 therapist for 6 hours a day. They're looking for a reimbursement of $45 per hour, which is a pretty reasonable hourly rate, if you will. Again, they're not looking for, they are looking for no rent for that space. And you'll see that they have that graduating up from quarter 1, 1 therapist, quarter 2, there's 2 therapists, quarter 3, there's 2 therapists and 2 different times. Same thing with quarter 4, it grows up a little bit more. So what you're looking at is an increasing number of services over a certain amount of time, with the expectation of a cost at $45 an hour that the district would fund. And then this would be open to any district community member to come in to be able to have some immediate access. The conversation that I had with Lisa and the team was essentially, we're not expecting to provide long-term therapeutic relationships. The idea is this would be a great triage, capture, and or bridge process. So let's say Bianca is having a challenge we would be able to offer her an initial sort of triage. Maybe her insurance says, yeah, we can get you in 3 months.
Right.
But she needs to see someone now. And the idea was that she could start to see Palomar. If her insurance was someplace else, they could at least give her some support, maybe stabilize, resource, and then do a soft transfer. Or it's someone who's having an immediate crisis challenge and just needs to have some more immediate support. There's a number of different ways that this program could support the mental health needs of our community. So they've given us a good draft here of what that looks like. Lisa is with us. Hopefully she's still there. So Lisa, you'd have to unmute yourself if you have any additional comments on this that I haven't addressed.
I am here. Thank you very much, Rachel. No, I think you covered it well. I think what our thought process in our discussions with you was to sort of start off small and build from there as the, well, depending of course on need. If we needed to build faster or slow down the acceleration, we could do that as well. But to just be able to provide that on-site immediate response, and then the connection and linkage to other resources if necessary.
So that's one of those that's being put forward for consideration. We briefly also looked at this at the most recent strategic planning. We would move this forward to the June meeting, but again, I think this is a good place for discussion around the interest in this type of programming at the facility, whether this is the type of services, pace, process that the board is interested in pursuing as we bring more services to the center.
So this is all encompassing with regard to family dynamics. It's from the children to the grandparents, and it's not everything in between. Everything in between, whatever you call family, this is what they address.
Right.
I think that's wonderful. The other thing I wanted to ask was, do they have, or will they consider incorporating some kind of a AI application where you might be able to have a person put the headphones on and just listen to something that will calm them down, help them get grounded to address whatever, like homework, that kind of thing.
Well, there's certainly many app-based programs for different kinds of conditions that could be used. I wouldn't use the word AI. We had, before AI even became real,
right? We
have lots of apps that are bona fide and good to use. So that's a great follow-up tool.
Yeah, I think it would be wonderful to have an extension of their program, to have some kind of an audio program to help make it easier. But I think it's a great idea to be considered and see how it goes. We've had a long relationship with them, and they've always been such an asset to the community and worked very closely with our schools. I think it's well worthy to bring before the board for consideration.
So I heard 2 rooms and $35K for funding a person or 2. That's kind of so is this fall into, are you saying MOU or is this a grant?
This would be an MOU, it would not be a grant.
And why the differentiation?
So because this would be ongoing programming and it falls outside just the one-time grant window, the expectation is we would probably
more core. Is that what
Yes,
more core programming. We're also talking about it not falling within just one fiscal year. We would probably say, do we want to do this for a potential 1 year with the option to extend or something of that nature?
Is there any revenue generation from these programs? Is it all, I mean, they
for them potentially, right. They could bill any individual's insurances, but the idea is we need to be able to offer it to any community member in need. So if there is a billable, they would address that and they would handle it.
And it would reduce our cost.
It would not reduce our cost.
That's where I was leaving that. So
there is no built-in this proposal. There is no expected reimbursement built into the process.
So my only request would be that what's patient load or level does it become a revenue generation, or we start doing a co-funding relationship? If we're seeing positive success growth, we're seeing positive revenue growth. At some point, do we come back and say, is there a hurdle that we co-fund or they help fund? That's my only thing.
Yeah, and that's where
As
we
test
could,
it. We gotta test
could
it.
potentially build that into the
Yeah,
negotiation.
farther down the road.
Yeah.
And
You know, build it-
utilization.
Build it, see it, grow it. Yep, I hear you.
Is that not something else that PACE would be interested if you had it to offer here? Because that would be a part of the HMO that they get paid for. They have to provide those kinds of services.
Potentially,
It
but
could
we
be a
can't commingle those two conversations just yet.
Got it.
Right.
Yeah.
Okay, potential.
Yeah, I mean, I guess my only, I guess, concern about the proposal, and I already mentioned it to Rachel, is just kind of the assumption that it's gonna escalate. You know, I mean, I would be more comfortable with like kind of just starting out with like the 1 day a week, one therapist type thing, and just kind of seeing how it goes, you know, type approach. Like I would hate to, yeah, I mean, I think that if it was a program that was doing really well, then I think they would, okay, well, you know, add another day or another counselor or whatever. But if not, I'd hate to have them using the space and just kind of sitting there, not, you know.
We can create the contract because it's our space.
Yeah.
And so the terms and conditions can be negotiable based on performance and
Yep.
et cetera.
Growth rates, et cetera. I think they took an attempt at that.
Yeah.
But you gotta have the metrics behind it to show how is it actually performing, right? Yeah.
And yes, and
Yeah.
I like the idea that their first quarter is 3 months. We're gonna know a lot at the end of the 3 months.
Yeah.
And if we wanted to say the second quarter keep one therapist, I mean, there's ways to word this. I like this because there is a totally pent up unmet need. I can't tell you how many times I hear from community members and from the schools, we don't have any place to refer parents. They can't get in for 3 months and the child is really suffering and they don't have the wherewithal to get anything. So I think this is a great, I'm going to call it a sure bet. But this is indicated as a needed piece of the community. And if we need to adjust this for our comfort, cool. I don't know whether we'll have to move to renovate those classrooms. We'll be talking about that in a minute, space. I do wonder if, and this could be blended in later, but if they get reimbursed for something, I really think then our contribution should be reduced, but let's percolate on that a little bit. You know, if they have one client that gets reimbursed $500, why would we be subsidizing that? Just a question.
Yeah.
But I like the idea.
I think there's
Maybe,
transparency on the dollars, right?
if Lisa could maybe speak to that. I mean, I'm not sure, if this is something that you guys have done in the past, if there's some expectation for profitability for Palomar.
Yeah, I'm still here. Quite honestly, in terms of generating revenue, it is our intention, of course, to gradually get there, but we recognize right now we have, you know, the ability to bill insurance in very limited cases. There are many, many people who just have, whose insurance is not one that we can, who possess insurance that we can't claim reimbursement for. We do a lot of Medi-Cal reimbursement in our offices, but the Medi-Cal reimbursement rates are very low. So what we tried to build in with the $45, our intent was $45 does not really cover our hourly costs, but we wanted to make sure that it would be something that we wouldn't completely take a bath if some of the reimbursements weren't there. So recognizing that there are going to be some clients that, yes, we could generate some reimbursement that will help fund the other clients for which there's no reimbursement.
Right.
Understood.
Okay.
So that cost
Fair
is kind
enough.
of already baked into those numbers.
Yeah.
Yeah. Okay.
Okay.
Awesome. Well, thank you. I appreciate that. That definitely helps clarify some of that for sure.
So I'll be,
on the next board agenda.
I'll work with both of these groups and we'll probably have, Lisa, I'll invite you or your team to be at the June board meeting so that we can discuss and fully pursue what it might take if we decide to go this avenue. And then obviously there's the assumption that we would work with Jeff to look at what would contracts look like. So this is not something that's off the shelf or ready to sign. this is a new exploratory thing, so we would have to identify what would reporting back to the district look like so that we can make sure that we're seeing what does that number look like? What does the district's investment in this program result in?
Yes.
So
Up and coming bucket.
Up and coming bucket.
there's a lot of buckets.
Okay, so we'll move on to the
Thank you, Lisa.
next item, which is the redevelopment of the Community Health and Wellness Center. So obviously this is a topic that's come up, you know, over and over again. I think that at the last time we discussed it, it was basically, hey, the objective is to build it up to where we can use it and kind of hit some of the areas that were obvious areas of need. Jennifer, do you have anything to add? I mean, from facilities perspective.
We talk about that a lot.
Okay.
So we've confirmed that the low hanging fruit that we all said would be our object of our efforts are well on the way. The bigger issue has to do with the parking lot, which involves the solar, which involves ADA access.
Yeah.
So it's a large issue that we are coming back to the board with recommendations on how to proceed with that.
Awesome.
And that we, Barbara and I with Roy was with us, which is an important partner and voice. Our recommendation is going to be that we look at that as a full systematic effort, which is going to take time.
Mm-hmm.
So it could be 18 months. And in the meantime, that
just the parking lot infrastructure.
Parking lot, solar infrastructure,
yeah.
ADA compliance, that whole big picture.
Yeah.
But in the meantime, to make that parking lot safer, we would do some temporary chalking. Restriping.
Okay.
Because we don't think it's a good idea to invest thousands in doing that parking lot and then come back and rip it up to get the solar infrastructure and lighting in there.
Yeah.
So that's our big idea.
It was recommended that we designated the spacing and save the cost of doing the quick Band-Aid fix with a slurry or asphalt type top, because it would not be a permanent solution. We'd have to tear that up, basically throw that money away to get to where we want to go with the complete restoration of the parking lot. So that was a thought that was put out there.
Yeah.
So you're trying to be cost effective and just do it once. But in the meantime, utilize, what you have available to work with.
Yeah, absolutely.
So that was the one thing.
And so we, the facility committee would say to our board colleagues, if everything that we said we wanted to do is either done or underway, the house cannot be completed with the bathroom renovation until we do the ADA compliance.
Okay.
Which will relate to the parking lot because handicap parking. So we'll be coming to the board with that idea to discuss.
Okay.
We have not taken up building A at all, but that is at least of interest to me. I hope we're going to be able to talk about that. Is that a fair representation, Barbara?
Yes, and we are exploring overtures by a phone company for facilitating.
So it's not a cell phone tower.
No, that's right.
Let's be clear, it's a communication tower. So let me jump in on this because I did the site. Thank you. I did the site visit yesterday. We were contacted by the Western Fire Chiefs Association, who in partnership with a number of different communications providers, the AT&Ts and such, to put in these various communication towers so that they can support an entity project called FirstNet. And FirstNet is putting and expanding the communication networks for first responders in the rural areas, right? So communication towers, all the cell phone towers went out in the main areas so that the Verizons and AT&Ts could have cell phones everywhere. What's happened is that the emergency responders are more and more using computers, computer modeling, all of that for communication and prognostication of where fires and disasters are. What they found is that the existing cellular tower network is not sufficient for the first responder needs. So
so now we have to go now.
Yeah. So what we're finding is that, or what they're finding, I'm so part of it, right? That they are looking for strategic rural locations where they can put these communication towers that are dedicated primarily to this FirstNet communication network. AT&T is the primary partner with them for that. But these communication tower companies would take a lot of the funding from the Inflation Reduction Act, the Build Back Better Act, all these federal programs, and they're putting this broadband access in the rural communities. What it would mean is that the communication tower could be at the wellness center. It would have the FirstNet communication process, and that group also negotiates with all of the cellular providers to put their networks on it as well. So in theory, it would be a communication tower that would have the AT&T, it would have Verizon, it could have everybody with it. They pay to bring the fiber network to the trunk of the building. They pay for all of that. And then because they are using that land, they pay a space rent, and they build in an escalation of that space rent. So I walked the site yesterday with the tower people, their sub-engineering. They're going to send me plans and they'll send that to us. But his initial feedback of where it would fit. So imagine you're at the wellness center, you know where the education building is, that garden space that was in the back that's fenced, that space back there is more than ideal. It has power, it has access to everything that they need. It's hidden away, so from street view, it doesn't look like big ugly tower in the middle of anything. The cellular towers and the communication towers have changed a lot in the last 20 years. They don't look like just big concrete structures with a pole and a big palm tree anymore. So he's taken a look at that. There's a number of different options as far as the types of enclosures, the type of, and I've forgotten the term he used, but the pole can look like a pine tree. It can look like a number of different things. So they would bring that all forward to us, as well as a potential rent that they would be able to provide to the district. The expectation is that that monthly rent that they would provide to the district, could it be anywhere from $200 to $2,500 a month for that, using that space.
Between 2,000 and 2,500.
Not
$2 and $2.
Right. Right.
I'll take the 2,500, please.
Right.
The margaritas.
Right.
Would you be so kind as to keep it in the back of your mind, your communications with them, if there's going to be any kind of environmental impact situation that we're going to have to deal with?
So in speaking with the technician yesterday, they come out, Western Fire and the communications group, they walk alongside of the district. A public hearing is required. They do have to work with planning group, and they come alongside and bring all the technical specifications, scientific information, all of the potential concerns. They've been doing this throughout the United States for a few decades. So there's a lot of good information around it. They would bring that expertise forward with us.
Sounds fair.
Does that project impact any of our near-term schedules on the capital improvements?
It actually is potentially consistent with it. So okay. In speaking with the technician yesterday, I said, if we were to start today, what is the timeline? And they're about 18 months out. That's actually about the same timeline we're talking about for parking lot and solar installation.
And that was my second question. Why is it 18 months? Did we not have all the permitting and all the?
No, none of that.
None of that. Okay, I thought we were farther down the pipe.
None of that.
Or at least parking lot.
Nope.
And solar.
Nope. No? Okay. None of that.
We got a major use permit. That's what we got.
Okay.
Yeah, and that took me 2 years.
2 years. Yeah.
So the design that we had with Taylor Design was design documents only. That obviously has been set on the shelf, but we did not actually have any construction documents. Those were design documents only.
A couple $100,000 if you want those.
I thought there was a schedule wrapped around that when I first jumped on here. I thought that was pretty well scheduled out in terms of getting the permits, getting the work done, and getting it all completed.
Had we gone forward with a contract to go to the next level of construction, that was the timeline.
Okay.
I know we talked previously about potentially getting, maybe a county grant or something for maybe the solar setup. Do you have any?
So
Potential update on that, or?
yeah, so the county grant for solar, there were multiple pathways we were doing. So the goal was if we wanted to put in solar and we were not going with the Taylor design, that was the path. So we had to start working with potential vendors to give us at least a general estimate of what that would cost, so that we could then start seeking grant funding. While exploring that path with the parking lot and everything, we had another opportunity presented to us, and we will see this come back to us at the June meeting. Probably not at the June board meeting. There's a scheduling conflict, but it's coming forward.
Okay.
There is an entity called Site Logic, which works a lot with special districts and municipalities that specifically does this level of infrastructure projects, specifically to our solar, battery backup, and the asphalting property. Their niche, if you will, with the special district municipal world is that they know how to also access all of the federal and state funding opportunities. So the Inflation Reduction Act is the main one right now. Within that was built this idea of how do we support broadband into the underserved communities? How do we bring solar, self-generation, all of that, right? So they know how to tap into getting those funds to help fund this program. They have done an initial analysis for us, and they're going to bring more information to us. But between being classified as an underserved community, which we are, that, and then there was a couple others, we would at least get 40% of the project funded from the Inflation Reduction Act funds alone, let alone there was a couple of state and others that they could potentially research as well. So let's say the project cost comes in at, I'm totally make this up, it's $300,000. 40% of that would already be paid for. Now we would have to front load it, we would have to pay for it, and then you get reimbursed through this act. The cash flow is not our challenge for that, so that's one idea. Once we had a cost for that, we can also then pursue, let's see what the county will give us. And then they would also be able to direct us towards other potential state programming that's falling in line with some of the federal funding options.
Any deadlines looming on those?
They're not immediate. No, there's some that are through, I want to say he said there was several through 2025, but they're going to come out and present that because he has more expertise on those dollars.
So as part of the 3 or 5 year, is there a stated specific objective there for 1, communication tower, 2, asphalt, 3, solar, of a time frame that we have to make those decisions and pull the trigger?
Absolutely not. Okay, there's no plan to that.
I would propose, as we're going through all this, that we tack those on there, because that seems really critical that the ball rolls on those.
Yeah, to me, from a facilities property component, putting in if we were to go this way, the communication first, while we're going through the permitting and design process for all solar, because once that tower is in, then we can go through and do the rest of solar and asphalt. But with that solar and asphalt, we also congruently at the same time have to be working on the house ADA.
Correct.
Those two have to kind of live together.
And I guess related, I'm assuming not, but the communication tower would not be part of our power generation, or would they be a separate line getting run for that?
It's its own separate entity.
Separate thing. Okay, good.
However, we could ask for a discount for seniors in the services for AT&T for the community.
That might be another line of questioning right there.
Just a question on the communication tower. I mean, it's like $24,000 a year. I mean, is there some sort of benefit that we're getting besides that for like giving up the space right next to the educational buildings where we have a garden already set up? I mean, well, what do we get besides $2,000 a month? It's not really that big of a deal. I mean, personally, I would rather have the garden right there than a cell tower. I mean, for for the
Well, he's gotta go
cost.
to
I
public
mean,
hearing, so you
Well,
might have
yeah.
other people agree with you.
Yeah, I mean, well, if you're in a public hearing, if we vote to do that,
Oh, yeah.
put that contract in, I mean, I just don't understand, like, you know, what would be the benefit, I mean, besides the $2,000 a month, I mean, which isn't very much money in comparison to our budget, I mean, it's a pretty small component. I mean, we're talking about, where we're potentially gonna put this PACE program, having a cell tower 6 feet away from it or whatever, instead of just having the space right there, I mean, I
guess it raises the question, is there another dead spot that we're never gonna use it, we can drop it?
yeah, I mean,
I'm not
No,
willing to
so
throw it
in walking the property,
Just
that's
the public
really the only place
occupancy.
that it can
for
go.
line
I
of
mean,
sight and everything they need, yeah.
yeah, between line of sight and access, so there are other options for where we could put gardens, there are other options for different programming spots. That space back there, if we were going to develop full gardens, we have to redevelop the space, because right now, just the little chain link garden space is,
yeah,
it's a hobby garden, it's not the demonstration garden. We were going to have to terrace that back area. It potentially, Teresa and I had talked about this, where that's at now, where the old swing set used to be, down there between that and the playground, that area is more level and more accessible. Moving the gardens to a space that's accessible has been a little bit more likely, but that is just if potentials.
yeah. I mean, I don't know about the garden space and all that. I mean, I don't really care about generating $24,000 a year. And, you know, I mean, to me, I'd be like, well, what else? What else do we get? I mean, at the end of the day, it's supposed to be a community area where we're making it aesthetically pleasing and we're going through all this development. I don't know why we would, you know, put that in the mix. We have a lot of stuff going on or whatever, unless there was some benefit or something that you guys saw, like, you know, was the real good thing we're getting out of it. I mean,
Well, I agree with you, it's an opportunity cost.
Yeah.
If we let go of that, we've lost an opportunity to do something there,
Yeah.
right? But North County Fire.
It would benefit all the first responders, whether it's Cal Fire or North County, anyone any first responder would be able to tap into FirstNet, and they would gain immediate access to communication networks in the event of disaster. That's one of the
Community benefit.
community benefits.
but there's other spots in Fallbrook they could put it. If we
Might
say
be.
no, they'll just go somewhere else. And
Right.
I know that, probably 4 years ago, we had, Roy had come to us about an opportunity to put a cell phone tower at the property before, and it was, you know, it was more than 2,000 a month, I believe, and, you know.
Well, and keep in mind, the 2,000 is the low ball number. We don't have all the information yet.
Yeah.
So he's gonna be bringing that forward, but that was the $22,000 to $2,500 a month. That, I just wanna make sure that it's not a hard number yet.
Yeah, I'm just like, you know, even in that general ballpark, we're talking about 30,000 at most.
What if we multiplied it then and asked them to put a tower into each one of our districts, Fallbrook, Council, Duluth, and Rainbow?
We don't own land in all those districts.
Sorry?
We don't own land in
Yeah,
those
it's
districts.
all about coverage map at that point. too.
I would say the opportunity cost is important to look at.
Yeah.
That space there, I visited it when it was the school a lot.
Yeah.
And that space is not visible really to the aesthetic that I hope we're gonna have there, you know, when people walk in. So I would say if the board had a interest, we would name what the appropriate amount of income would be.
Yeah.
And, you know, I mean, 30,000 does fund some grants.
True.
Yeah. So it would be important for the board's sensibility on adequate value.
Yeah.
I don't know whether that's $50,000 or $75,000 a year, but I do think there's a community benefit. And you're right, Bill. I don't know what other locations would work for this.
Yeah.
But I love the idea of boosting the community's ability to have first responder connectivity. And if we're kind of the apex of it, maybe that's why they picked us. I don't know.
Yeah.
Yeah. So I think we got thinking to do.
Little free PR as well.
Yeah, we'll make sure we get good PR on that.
But we'll have this
we'll have more
information brought in.
Okay, cool. Thanks for all your work on that.
Just to kind of continue with this discussion here, we kind of touched on the general infrastructure, I think that's obviously the first component to attack, that parking lot, the potential for solar and, just kind of, yeah, fixing that stuff so that, I mean, we have a lot of programming going on and we can't just have like a dirt lot, so.
Yeah.
I mean, the quicker we can get that on there, I don't know if that's something that needs to go to, facilities and then like an RFP,
Yeah.
I don't know where we're at on that.
We're already working with facilities on that, so,
Okay,
Site Logic will bring the information back to us about what that whole, solar, backup battery and the asphalt parking lot, what that project will entail, so they're gonna bring that information.
are they looking for like a contract for like a project management?
We
or
don't have any of that yet, they would bring forward what they can and can't do.
Okay,
And then we can measure it against what the county could do for us.
okay,
You know, it's our first stop, because they do an integrated service deal, including getting us all of our rebates. And if they give us a 40-60 split, we can take a minute and go to the county and say, what would it be if we did it outside this parameter?
yeah,
We want the best deal. We
Yeah.
want the best deal,
Yeah.
so.
The county's probably not gonna give us close to $200,000 reimbursement on this
Yeah.
project.
Yeah,
Yeah.
but we would measure to make sure that we're getting the best deal on the rebates.
Yeah.
So that's coming back, and it's coming back. They're coming not in June, but probably July to talk to us about it.
And or we could bring together a special if we find it's warranted enough. It's a complicated enough issue, it might be worth it.
Yeah.
And there's enough interest to get it started
Yeah.
to maybe
Yeah.
not kick it to July.
Okay, not June, but maybe after that. Okay.
yeah, so I mean, cause I would say for me, like that aspect of it should just, you know, we need to get that going because, you know, it's gonna be like RFPs and, you know, like, permits,
yeah.
you know, and when it all starts, it's gonna disrupt services, you know, it's gonna do something to us, so, you know, the quicker we can get that out, like, get that.
Make a
kind of,
decision
yeah,
about how to do it.
Yeah, I mean, if. we
Yeah, I
can
mean,
get
so the
that
question
listed
becomes,
out.
if the board is committed to having solar and or potentially to be able to have solar generate for backup so that we could potentially serve as off the grid support for the community. If the board is committed to do that, we need to do that infrastructure, and that's gonna take some time.
Yeah.
Or you can all decide, let's go ahead and pay, get the parking lot done while we pursue this, and we're willing to pay for that project twice because of the priorities and timelines. That's a complicated decision that I don't know that everyone's willing to pay twice
I
for.
think you
Yeah.
left, that's what I was gonna say. The third option is we say we're gonna go for a systems approach, do all of the work at once, which may be 18 months. But we're gonna do the parking lot in a way that makes it safer. But we're not gonna invest in a fully new parking lot.
Okay, so like skin coated or something?
can't do that.
No,
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 but
so
we
you're
can do
grinding
the,
out.
we can do the
We can at
chopping.
least do the stripe painting.
Yes, yes,
Okay.
It wouldn't fix the asphalt gatoring, but
right.
it would at least provide the visibility of the parking spaces, which is, we can do that as soon as I get the reference from Roy on who does that.
Yeah, but Barbara and I and Roy talked about this in facilities, and our recommendation to you, which will be coming, is that we do the short fix on the painting the spaces with a professional, and that we get the information on an integrated solar, ADA, and parking lot renovation all at once. But it's not, but we have to be willing to know that that's gonna take time.
yeah, okay. No, I understand, like, yeah, I mean, the quicker we can get, you know, at least the information or whatever, that'd be good. I mean, I don't know, if they're gonna come up with some cost estimates and all that or whatever, but I mean, it's definitely something that we gotta attack, even if it's a longer term thing.
Yeah,
At least if
let's
we
get
approve
started.
it and, you know, like, kind of get moving on that.
Rachel, is there any chance that since they can't come to the June meeting, could they come between now and the June meeting?
Absolutely, we just haven't set a time.
And we could have a special?
I have a follow-up meeting with their representative on Monday,
Okay,
to let him know that there was at least a favorable interest from facilities and that we were talking about it today. And then if you're open to setting a special, I will talk to Josh and say, hey, they're interested. he lives in the Canyon Lake area. When can you drive your physical body here
Right.
to answer questions? Because it's a lot of interest that needs to have good questions on.
Exactly. So, if I may suggest, facilities, Barbara, track me on this. We'd like to request a sooner than later meeting with them.
Yeah.
Okay, even if it's a special.
Yeah,
Okay.
and if it's gonna be a belabored effort with them, you know, maybe we need to look at other communications providers.
Well, we'll get his first because he
Right.
knows the secret code to federal and state subsidies. And then we'll move off of that. We're not agreeing to anything with him. We're just listening to him.
Right.
Yeah.
Okay.
Maybe we should invite him to lunch.
I've already walked the site with them.
Oh, lunch is in order.
Yeah. Oh, he's already bought me lunch.
He bought her lunch. That's the way we like it.
We'll have iced beverages.
Okay.
So, we have a couple other, areas of the property. I don't know if you have any recommendations or any thoughts on some of those things. Obviously, I think that the first priority is what we just already talked about,
Right.
but I mean, anything from facilities that you guys would like to?
Nothing
throw out
from
there?
facilities. We haven't gone past the board direction on low hanging fruit
Yeah,
and down the parking lot, but I have something as an individual board member I'd like to put on the table.
please.
Okay, so when it comes to building A, we made a decision for low hanging fruit and we're after that. So I'd like to know my colleagues' sense and ideas. The current fellowship hall was reimagined with new bathrooms, relocating them, office space and accentuated community space. And that was integrated with redesign of the fellowship of the sanctuary, current sanctuary. I don't know whether we're at a point where we want to discuss that and get some things brewing because we just saw it's 18 months to do the parking lot, or whether this consensus is that we not pursue it. But I do think and it also had a kitchen remodel for commercial kitchen, which ties into a lot of our hopes for the future, right? So are we up for a future conversation on renewing the conversation around the sanctuary and the fellowship hall? Or would you prefer facilities to not pursue that? Or what are people feeling about it?
Well, has there been identified what max priority is needed to support the programs that are here and coming?
Well, that's
Is this the room or is it the education center that?
So the education center, as far as programming, is already done.
So we can take that off the list.
We can
right
take
now?
that off the list.
Okay.
The house, other than the ADA component, which is big enough on its own, is already kind of earmarked for very small programming, whether, let's say Palomar comes in, that would be the room for there.
Okay.
Right now, we're running DPP out of there as well.
Yeah.
But eventually it's not gonna work with that kitchen, it can't grow, whatever.
Mhm.
We are technically full in all the property spaces. So if we're going to grow programming to something bigger, right now, building A is very limited usage, especially the sanctuary part, because with the way it's designed, it's really loud. So we can use the hall, fellowship hall part, where the restroom challenges and the demonstration kitchen access. We're full until we build that. I guess that's what I should say as the short answer. Until we decide what to do with that building, there's not much more we can expand.
Any thoughts?
Well, I think it's just, for me, it's what I'm missing is just the next 10 projects on that site. What are the priority orders? And do we start knocking them off piece by piece with obviously a look at not screwing up the overall plan, but is there, again, small bites that we can be taking? I'm a big proponent of just kind of showing progress and visible progress.
Yeah, and
That gets the heat off us a little bit in terms of, yeah, things are happening, they're moving.
Yeah.
Take a look.
So I think the plan for the parking lot solar, that with that plan going forward.
Yes.
And that direction, the only thing that's left is dealing with building A.
Right, we've done all the low hanging fruit and
Yeah.
quick things, and now the asphalt, I mean, the parking lot and solar. And maybe this is, I mean, we're full, so.
I mean, I guess my thoughts are kind of like, I think, kind of what we're getting back to is that like $10 million estimate thing, you know, like, so because,
Or reimagine.
yeah, I mean, for sure, like, because, at the end of the day, like, we're talking about a major, like the infrastructure part of it, not even sure how much it's gonna cost, you know, like, I think we have to get probably a better idea of that, or I'd like to at least have an idea how much is that gonna cost. I think with, the last kind of estimates that we got, like there was some super high cost for some of the grading and like, you know, some of the stuff that you wouldn't even think would be that big of a deal or whatever,
Right.
so. And then the sanctuary fellowship hall portion of it was, you have to forgive my memory, but I thought it was, you know, in the millions for sure, like, you know, so, I mean, at the end of the day, it's like, are we gonna jump on that? Like, you know, I don't know that we are, you know, I mean, it didn't seem like the board was in favor of that gigantic sort of number or whatever, I don't know. You know, if the idea is to maybe potentially look at another design or, you know, just kind of look at it and see what we can do, or maybe get an estimate for just potentially like some of the stuff that we talked about doing, like redoing the bathrooms,
Right.
and maybe the kitchen.
Yeah.
I mean, I would,
Meeting rooms.
I would be open to like, I mean, if we could get some sort of estimate on something like that, you know, I think that that's like, you know, if we're talking like a smaller bite approach, I mean, that's more of the practical side of it. I would be more up for, you know, like sort of changes in the facilities like that, rather than like, say, like a gigantic glass wall or whatever. I mean, I think it looks really cool, but you know, if we could maybe get the cost down on doing like, again, like maybe the bathrooms and maybe put a kitchen in and see like what that looks like. I mean, if we could get like a practical number on that and say, hey, like for X amount of dollars, we can get, you know, these things done. I mean, I think we might be able to throw it to a vote and see what we can do or whatever, you know, I mean, I think that that would be probably an easier approach than saying like, well, I don't know what you think about. I mean, I thought that those pictures were beautiful. Like, I mean, I saw them right away. Wow.
I think those are yesterday's news.
Yeah, for sure.
So I think you've got a good strategic thought here, and that is, let's see what we find out from Logic, their ballpark on the asphalt and the solar and all. Let's see what that is. And then as a board, we can see what our assets remaining are.
Yeah.
Again, it's a proportionality thing, you know, how much do we spend on this particular thing? And Bill, I agree with you. I think there's a way for us to separate the fellowship hall renovation from the sanctuary. It's not ideal in terms of system thinking.
Yeah.
But there are ways, I think, we have to ask the experts, where we can renovate the fellowship hall, which had a very distinct purpose in mind, and would advance our ability to have a facility that's more highly functional.
Yeah.
And let the sanctuary wait if that's what the board wishes to do. But I think we have to stay open to the building A potential.
Yeah.
But let's get the solar asphalt thing nailed down, see what that is, and then come back to it.
Yeah.
Okay.
Sounds good to me.
Yes.
Terry, do you have any thoughts on any of that? I don't know if you're able to hear us here.
Is he there? Oh, there he is.
I am definitely here. Yes, I have some thoughts on it, and $10 million as it was presented by Tina Design, according to them, still wasn't going to be enough to do their vision. But I agree with Bill in that let's take a phased approach. Let's look at the projects that we need to get done in order to conduct the business we need to conduct and expand the services we need to expand. And if it takes us a couple years, and it might be cheaper to do everything at one point in time as opposed to stretching it out, you know, that still makes sense to me. because it gives us a lot more flexibility in the decision process. Do any of us have a perfect vision of what it's going to look like when it's done? Probably not. And that might require that we do some changes to the finished product, and that would be it. That would be a sin. So I'm good that we take it one step at a time, one project at a time.
Okay, and I think on behalf of the facilities committee, the $10 million plan is yesterday's news. It's not at play anymore.
Yeah.
It's not in our hearts and minds. It's done, it's gone. And so if we can move forward with our thinking and not reference that, it would probably be great.
Yeah.
I guarantee you $10 million is not on my agenda to even discuss.
Done. Okay.
Okay, well, I think we're pretty well solid on that. You know, I think it gives you guys in facilities some direction, some stuff to do there.
Absolutely.
Whatever the wheels turn. I think the board's been pretty supportive of just, you know, getting that place up to where we want it to be. And, you know, so that's that. We have one more item here. So it's the so this is an item that's come around a few times. This started with we started in strategic planning. Barbara wanted to look at this, the mission statement, vision, values, etc., all the different words. So Barbara wanted to look at this in strategic planning and maybe switch around some things. Well, we also kind of looked at it in government relations and kind of had some thoughts there or whatever. So, you know, I'm not sure if you guys have any specific thoughts on it or.
I personally would say this is a work in progress as we move forward in what we're doing. If there is something else that we want to integrate into the statement, we can take that up and bring it to the board at the time. But for right now, it's a working tool. We're going in the right direction, and I'm at a loss to how I can improve it unless I steal somebody else's, you know, because we are unique in the fact that we are not a hospital. We don't have a hospital, so our wellness program and what we're doing is to be developed as we're going along, and this captures this vision to begin with, but as it firms up, it may turn into something else.
Yeah.
But I think we're on the right path, and if it's not broke, don't fix it. We could improve, you know, as the time goes on, but for right now, I think that we're going down the right path.
Okay. So, Mike, any thoughts?
I presented my thoughts. You guys can use them as you need them.
Yeah.
Yep.
What were they? Did I see them?
The presentation I developed from the committee. I don't know if that's how they got.
I thought we were going to discuss that here. So I
thought we covered. Okay, I thought that was a cover and pass on. So my mistake.
We didn't communicate that clearly. I'm sorry. I thought we were going to discuss that here. That's why that was.
Bring it up, or you want to?
Yeah,
let's around to a board meeting.
Absolutely, unless you want to, you know, bring it up at the board.
Let's see that.
Well, let's take a peek. I'd like to see.
I threw together some thoughts, just based on what I was seeing, and thought that was going to get kind of rolled around. So
well, now it's gonna roll around.
Roll around.
Round them up.
Yeah.
Sure. So as we're kind of getting that up, I guess, you know, my kind of thoughts are that I've definitely kind of looked at it a couple thousand times, really. Like I'm trying to, you know, push around some of the words and stuff, you know. You know, to me, like obviously the mission statement's a big deal. Like you want it to, you know, guide the organization and you know, set the tone. But I mean, personally, I don't have any better words to contribute, you know. I mean, we, as a district, we do a lot of things, like obviously being a government organization and funding grants and, you know, but at the end of the day, like I said, I don't really have any particular changes that I would do, you know, but open to whatever.
So we found that PowerPoint.
Would you like me to present it or just kind of walk through it? Okay.
We'll put it on the board. That's kind of when I put the like.
Do you have a screen?
Uh-huh.
Do you mind if I stand up here? Cause I need to stretch a little bit.
Yeah, and I have a white board thingy there for
Yeah.
you if you wanted to draw on it. We'll have it up there in just a second.
So the reason I kind of dove into this is I have a lot of passion around vision, mission statements and how it drives organizations, how it drives employees, how it brings an organization together with a common purpose. So I took a quick shot, boy, almost a month ago now. So go ahead and pass on through. So and these are just thoughts that I put down based on the listening I've had and what I've uncovered and heard through all the meetings I've been able to attend. This is the current one. I think this is what we have in front of us. So I went down and started kind of walking through a process. Go ahead. Of a vision statement framework and kind of what it looks like based on things I've used in the past and books I've read. You know, it's for what target customer, what's your statement of opportunity, what's your product or service category, your benefit, your reason to buy, your primary competitive alternative, unlike who we're up against, a little different for us. And the statement of primary differentiation, what makes you unique. So go ahead. So I took some elements and tried to just take a shot at that framework given our organization. So for residents of Fallbrook, Rainbow, Bonsall, Duluth, who need health and wellness services, we, as a government special district, partner with community-based health program providers and non-district served communities. Our product provides information, programs, services to cover all of our community's health and wellness needs. So again, that's just an element and kind of how you break those up to get the key components that are important to what we bring. Next slide. So I took some examples of good vision statements. So vision to me has always been your wild, awesome goal. What are you gonna look like in 10 years? What's that picture of success that drives you to a point of we have done awesomeness? And some of the examples that I've dealt with and personally been involved in developing in HP printing, for instance, ours is very simple. We were bound for billions and we started the inkjet printing business. We were at zero revenue. We said, we're going to be bound for billions. We didn't know what that meant. We had no idea how we're going to get there. Tesla, to create the most compelling car company of the 21st century by driving the world's transition to electric vehicles. Alzheimer's Associate, a world without Alzheimer and all other dementia. These are big goals, right? And you have no idea how you're going to get there. Google, provide access to the world's information in one click.
Yeah.
Those are very resonating. They stick. You get it. So go ahead. The considerations: true purpose. What do you hope to achieve? Core values. How does the mission statement align with the core values of the organization? So obviously, as you're going through that, you want to be aligned. How does it align with the culture that we're creating? Rachel's team's creating. Will the strategic goals for the next 5 to 10 years enable our statement to become to fruition? I mean, can we meet and get there? If you don't believe you can get there, then don't waste your time. Okay. Let's see, where are we here? I threw out some examples. These aren't the right answer, but I wanted to kind of stretch us a little bit and get some ideas. Best district in California for delivering the highest quality health and wellness services to our served community. Nationally recognized health district delivering partnerships, programs, and services to support greater lifespan and independence. Creating positive demand for expanded health and wellness services. This one came out because this captured me, some of the negative comments that typically come in, and how do we address that? So if you turn that around, say, we're going to create an organization that's people are pulling us to do more. That's really successful. So that was kind of some of the vision thoughts I had. Mission statement, purpose, and examples. Very concise explanation of our reason for existence. Some examples, here's the Red Cross. Will prevent, alleviate human suffering in the face of emergencies by mobilizing the power of volunteers and generosity of donors. That's a pretty powerful statement. You think about it. They spent a lot of time on that. Yeah. That's not just a random thought that came out. They worked on that for months. I can guarantee you. IKEA to offer a wide range of well-designed, functional home furnishing products at prices so low that you can never put it together. No, I'm just kidding. Some ideas for the mission statement that I just threw together. Fallbrook Regional Health District allocates funds to programs, nonprofits, and service providers to improve the health and wellness of our served communities, enabling longer lifespans and independence. Through highly skilled and passionate staff, again, this is turning a little bit, volunteers, partners to Fallbrook, passionate staff, volunteers, and partners, the Fallbrook Regional Health District allocates funds to support services that increase the health and wellness of our served communities. Now, this could be expanded a little bit. It's just not about allocating funds. We do our own thing, but there is a cost and there are resources that we're setting forward. And what's next? And then the values, I just took a shot at those. I pulled the ones that you're obviously using, but I also am seeing there's passion here, focused, decisive. I think this is something that I've noticed it seems to be hard, and that's just me. I have some impatience in terms of decisions and how long they take. But just getting that focus, decisive, and being inclusive, transparency is huge, obviously, accountability, integrity. The community is looking for us to do the right thing with the funds that we have in front of us, and serving our partners in a very positive and integrity way. So that was just kind of my couple hours of just wrestling through what I've heard, some thoughts on some ideas. We can incorporate that in whatever way we feel necessary, but I felt like we were missing a little bit of really what we're about and what we're trying to achieve. So that was my my thoughts on that. So I'm happy to discuss.
Thank you, Mike. It's really very well thought out and very well received, and I think we'd like to probably all get a copy of that to kind of tuck away and.
Happy to send her. We can get it sent around.
I'll have it for you. I'll have it for you before you.
Yep.
Working toward whatever changes we'd like to make in the future, but I would recommend getting everyone's input and kicking it around a little bit.
Yeah.
Yeah.
And then
maybe we can if we could maybe put that on the next board agenda. Maybe we can start with that framework, and if we want to cross out words or add anything,
throw darts at it. That's what it's there for.
And it's timely because we're beginning our new fiscal year July 1.
Absolutely.
So that's perfect. If we can do it at the May or June meeting.
Yeah, we can do that at the next available opportunity. We'll probably try to hammer it out and stuff. And yeah, thank you for putting that together for sure.
I enjoy doing those. I do enjoy.
So let's see. Okay, so do we have I'm sorry, Terry, did you have any comments on that last one?
The man's wearing shades now.
Must be in the sunshine.
Yeah, no, I'm good. I think you did a great job on it. And I think we can all pretty well buy into it. Good work on it.
Thank you.
Awesome. Jeff, do you have anything for us?
Mr. Scott?
Figured I'd give you an opportunity here.
Yeah, no, guys, I think you did a great job handling the meeting, Bill, and everything looks really good. Very positive day.
Awesome. Well, thank you. We appreciate it. Do we have any board member comments or future agenda items besides the count list that we threw out there for the future agendas?
I just wanted to let you know that I share in your little bit of anxiousness to get things done quickly.
I'm crawling. It's okay.
I want you to hang in there.
I am.
Because you learn as you go through the process, it's going to take a little longer than what you expected, and it's hard for us to.
I understand.
But I think we're doing marvelously well. I really believe that whatever the obstacle is, we can overcome it. I think the strength that we have in our board, in our ability to communicate with each other, identify the problems, work toward a solution, and make it a positive outcome. It makes it a win-win situation. If it doesn't work this way, how about we try that way? If that doesn't work that way, how about we either put this on pause and revisit it another time? You know, so the idea is that you don't get discouraged in the planning process, and you don't feel like your efforts are being not recognized.
And I just want to say, this is a tremendous board, and I think that we can expect to do wonderful things. And thank you, Bill, for your leadership and being here. This was a really great workshop, and I think it was well received by our partners in the community, the grant recipients as well. They know that we are hearing and feeling their pain. We'd like to find a way to solve it as well financially. So thank you.
Absolutely, thank you. Mike, anything?
Yeah, I echo that too, Barbara. That was a great sentiment, and I'm sorry I can't be there with you guys, but I really haven't missed much, even going through the airport. So good job.
Okay, thank you. Have a nice trip.
Safe journeys.
Safe journey.
Yeah. Mike, anything?
Thank you.
No additional thing, just, you know, dates, times, and milestones and moving.
Yeah. Jennifer, anything?
I'm good.
Okay. I just want to thank staff. I appreciate all the reports. You know, everything was very well organized. I know that I didn't have a chance to say much about it, but the last weekend of the public hearings, everything looked really great, and the posters, the facility looked really nice. So just wanted to thank staff, and Rachel, thanks for putting everything together. It looked really good. You know, obviously the attendance wasn't where we wanted, but it's moving in the right direction, and as a whole, we're definitely happy to see the programming and everything working out really well. So thank you.
Well, our next community event that will be put out there will have our newest employee. So starting June 5th, Jasmine Thomas, who is going to be our new outreach and communications coordinator,
awesome.
Will be able to make sure that all of those media and collaterals and all the pieces that build towards that awareness and messaging will be on board. So Mike, we'll tap you as soon as she gets started.
Anytime, ready to go.
And then we'll build into public engagement the development of that communication strategy, so that while we're moving on these other things at a slower pace, we can draft out very quickly the communication plan at least.
Yeah, might be great to have her at the next meeting. Yeah, for sure.
She starts June 5th. So
I think
she'll
that
be
plays out well. Yeah, that's good. Good.
Yeah.
We can grill her and have some fun.
You be nice to the new people.
Hey, she'll be a week in by then. Come on.
Right. Stop it.
Okay, just one more thing for me. I just wanted to encourage the other board members to utilize some of the resources and training that we have with CSDA and ACHD. I know being a new board member, one of the biggest things that kind of really got me up to speed is kind of I went to like the leadership academy that they had, and I did like a couple of those conferences, and it kind of seems dumb or whatever sometimes to like go do all that or whatever, but to be honest, seeing like all the different special districts and being able to talk to them about some of the challenges that they have, and some of the, you know, I mean, it's pretty common, like a lot of the stuff that's going on with special districts. Would definitely encourage, you know, to Terry, Mike, you know, if there's any of those that you guys are interested in, all the board, like, you know, I definitely encourage that, you know, the cost that it takes to get you guys there or whatever is like, it's definitely worth it or whatever. So I definitely recommend those. And sometimes that can help you like with like, you can see like on the pace of all the other districts or whatever. You might think we're lightning speed at that. So
no, I get it. Just recalibrating.
Talk to the cemetery districts. They're an interesting group. The cemetery districts, I had no idea.
Wow. They are
Something
really booming.
Oh yeah, there's a pile coming.
I'm not, I know.
Stop.
all right, we'll go ahead and adjourn this meeting.
Good
job.
Before 2:30.